What is going on, guys? As promised, it's Cypher here, and I'm giving you guys the Surgeon Simulator Breakdown Platinum Trophy Guide. This guide will be a full-length video on you getting the Platinum, and me showing you the best methods to get the Platinum or to do these certain surgeries over the many hours that I've played this game. Now, my next goal, since I've just revamped my channel, is to hit 500 subs. So if this video at all helps you out, please subscribe, like, and share. And I thank you guys, and I hope that this helps you. Without going on too much, let's get right into it. First thing you want to do when you start up the game is you'll notice the hand is moved by your controller. That is terrible. Do not do that unless you have balls of steel. No, just don't do it. Go ahead and press options and go to the left, and you're going to make the right stick your main hand rotation instead of motion sensor. This will make it much easier for you, so go ahead and just, switch it over. Make your life easier. The game already has fucking dodgy controls. So the first trophy we're going to get you guys warmed up to the game is called Doctor, Give Me the News. And all you have to do is answer this phone. What you want to do is, whenever you press L2, that makes your hand go down. Whenever you press R1, that'll make you pinch your index and your thumb. Whenever you press R2, that'll be your middle ring and pinky. So if you press all of them, haha, no, I'm just kidding. But basically, I usually only use R1 unless I'm trying to get a better grip. I'll use R2 with R1. So all you have to do for the first trophy is go down with L2, just gently press down. You don't have to be really careful because this trophy is very easy. Go L2 all the way down and pick it up, and I messed up. But I still got the trophy. That's how easy it is. It already registered that I picked it up. This phone is useless. Okay guys, now we'll move on to the next trophy. Alright guys, so the next trophy I have for you guys, it's a very easy one as well. And it's called Nigel The Secretary. And all you have to do is go down and pick up a pen by going down with L2 and pressing R1 to grip it. And just start pressing L2 to go on the notepad and just draw a penis. No, I'm just kidding. Just draw on it. After you draw a certain amount, that's going to actually crash the game. Okay. Was it because I said penis? Alright guys, sorry about that. Apparently we're playing a homophobic game. No, but again, Nigel the Secretary trophy. Just grab the pen, R2 and R1 to grab it, and L2 to go down, and then just keep writing until the trophy pops. And there you go guys, Nigel the Secretary. And we'll go ahead and go to operations. And we're going to go ahead and start our first trophy that's actually related to an operation. So this is when shit gets real. But I believe you guys can do this. If not, the blood is on your hands. So for this first trophy, it's very easy. It's called Like a Wet Paper Towel. And all you need to do is open up the icebox, go down and pick up the heart with R1, and just essentially kill Bob by throwing it off the side of the table. And that is going to pop the trophy, Like a Wet Paper Towel. Now, another trophy you can get knocked out of the way real quick is called Keyhole Surgery. And in order to do that, if I can grab the buzzsaw, you just need to grab the buzzsaw and go towards the edge of his ribs with L2 going downwards and just gently grind against the bone. You know you're hitting the bone when you see the chunks flying everywhere. This trophy, you have to get fairly close to the edge of his actual rib cage. Otherwise, the trophy will not pop. So, I'm going to be honest, I don't think I'm getting close enough. Don't be, worried if you hurt Bob or anything. You're not really trying to get a good score right now. You're just going for some simple beginner trophies, just to kind of warm you up to the mechanics. I want you guys to feel comfortable before I put you out, in these operating rooms and try to make ends meet and make a living. And as you can see, we pulled that out, and that did not give us the trophy. But that's fine. we can go ahead and try for another trophy. And this trophy is called the Beat of Your Heart. And in order to get that, all you need to do is remove the lung after you've taken the whole rib cage off and cut the heart out. You see these lines right here? This is one hitbox right here, which is going to cut all 3 of those red veins. So if you hit this red hitbox, if I can do that, there you go. It knocks off all 3 of those. So the only vein you have to hit is that first red one and then this purple one. And that's going to completely sever the heart. So in order to get like the beat of your heart, you want to go in and grab the heart out with R1 or R2, whatever's easier. Now you want to grab the radio. Okay, we're going to grab the radio and we're just going to put it in his chest. And as you can see, guys, we got the Beat of Your Heart trophy. And now from here, we're going to go ahead and just restart the operation. And we are going to try to get Keyhole Surgery again, which is to remove the rib cage from the outer edge, basically. Don't drug yourself like I just did. If you do, the blue needle will cure you. You'll learn about that later. For now, we'll just stick to beginner stuff. So again, try to get as close as you can. It helps to get a good grip on the saw. See, that's perfect. Just get as close as you can. Don't be too worried if you hurt him. There we go. If it doesn't pop this time, then the game actually just hates me. I may have ruined it right there by apparently chopping too high. I'm not exactly sure how that broke, but we'll see. Okay, as you see, guys, we got Keyhole Surgery from cutting the edges just as close as you possibly can. Keep trying until you get it. It's a bit of a dodgy trophy, but I believe in you guys. And from here, we're going to get Vworrrp Vworrrp. Weird trophy name. Basically, do not touch the heart that's in him right now. Just grab the healthy heart from the ice box and just place it in there. That's it. As you guys can see, Vworrrp Vworrrp has popped. We're going to go ahead and pick the heart back up. And now we're going to go ahead and sever the heart out. We're going to actually complete the heart surgery now. So in order to complete the heart surgery, you just cut that same hitbox I showed you, and then the purple one, and there you go. Now you can grab the heart out and put the new heart in. And as you guys can see, we got Kali Ma trophy as well. That is a time trial trophy. And we also got, I think I got this for completing the heart transplant. Now, if you get the time trial trophy, cool. If not, that's completely fine as well. I'll have a separate section for all the time trial trophies as well as the A++, which is what you're going to need. So for that time trial, all you guys have to do is complete that one in 1 minute and 50 seconds. So we actually just barely got it. So if you guys get it, awesome. If not, you can retry and you can go for it. It'll be good practice. But without further explanation, we'll just go to the next trophies. Alright guys, so the next trophy we're going for is called I Should Have Never Doubted Myself. And I actually want you to start the heart operation again. This will be good training for you since you're a beginner to the game. Well, if you are watching this, I'm assuming you're a beginner or you're learning the skills needed to get the platinum. Anyways, go back to the heart surgery. This will be really good practice. If you can A++ the heart surgery, then that's a good start. So what you want to do to make your A++ run a little easy is grab the buzzsaw and just gently tap it in this segment of his ribs. That's going to break that chunk. Do this segment next to it. This one as well. You essentially want to break 3 to 4 of his ribs. You can do more than that if you really need to, I suppose, but that should be more than fine. You're trying to go for an A++ on this surgery. And the way the A++ ratings work in this game, it's all based off of blood loss. So if he's lost a lot of blood, you will get a rating that would reflect how well you actually did on the operation. As you can see, we're at 5,226 milliliters of blood. After we remove his rib cage, I'm going to get a better grip on that scalpel. After we removed his rib cage, we can go ahead and hit those hitboxes that I've been telling you about. If I can do that. There we are. And we just need to hit the purple one now. I did skim his throat a little bit, but tough shit. We will go ahead and pull this out, and that should be more than sufficient enough to get an A++ rating for you guys. There is no rush. Take your time. If that's what it takes to get A++, then don't stress yourself. There you go, guys. I should have never doubted myself. We're going to go ahead and jump to the next section of the guide, and you will do your first double kidney transplant. Alright, guys, so we're here for the double kidney transplant, and you have 2 easy trophies to get on this one. I'm going to go ahead and just show you how to actually do it first, and then the other one is a time trial for 3 minutes. That way you don't feel overwhelmed. I will try to keep this video as short as I can, but like I said, I want to give people as much tips as possible because the mechanics are a lot to take in. So there's a hitbox here on the right side that I went down on. Then there's a hitbox here, as you see that this lower intestine is severed. And then there's one right here that you just have to keep kind of hitting, and then it'll finally get loose. And there's one right up here under the liver. Right there, you can see it, that little line. You want to keep hitting that until the lower intestine pops out just like that. You can also remove the stomach, which will give you more room while you do the surgery, which will just kind of make life easier for you. Now, all you do is pull all this stuff out of the way. And for this trophy, it's called About as Politically Correct as Fur. And in order to get that, you're just going to get his intestines by the middle and slap it on his face and put it on him like a scarf. And as you see, you'll get about as politically correct as fur. Now, in order to finish this operation, the time trial is 3 minutes, so I'm trying not to actually complete it so you guys can kind of learn this. You just have to press the scalpel against the kidneys, and that's going to just dislodge them really, really easily. You can move the liver? I'm not a doctor. I'm assuming that's the liver. And then go ahead and grab the kidneys, which can be a pain to grab sometimes. A good method to do is press R1 and R2 when you're actually digging in him. Stretch them out by letting go and then grabbing them. And you can kind of get in there a little easier. Sometimes it's a bit dodgy. Other times it works really well. Now all you have to do is actually put the kidneys in him. And you want to grab the right one and put it in the right one, and then you would want to grab the left one and put it in the left one. But for the sake of learning, I won't do it just yet. I'll talk about this needle here for a second. This green needle is actually what's used to slow down his blood loss. He was at 3 mils per second that he was losing, and as you can see, once I stabbed him, he went back up, it went back up or down, I guess. Jesus, what's wrong with me? To 0, causing him to lose no more blood, or at least not at a faster rate. So now that it's almost 3 minutes, we're going to go ahead and pop this kidney in there. And there you go, guys. As you can see, we finished that over the time trial limit. So now we're going to go ahead and try it for the time trial. I believe in you guys. I'm going to recommend grabbing this scalpel. 1 second, let me actually uncover it. Whoa, I did that horrible. Don't follow my movements. Okay, so this is by far my favorite scalpel. I do have a favorite scalpel. And it has a very nice reach. Now, I want you to go for that. And then go for the hitbox like I showed you. And that'll just, disconnect. Go ahead and do that. And then there's this one here, remember? And then there's one on top. And then there's also the stomach if you want to give yourself a little more room. Now, if you don't want to drop the scalpel and clean it all out, that's better because you save time like that. And as you can see, you can still see the kidneys and where they're kind of at. And you can kind of poke around there until you see it move. Once you see it move like that, it's dislodged. So as you guys can see, I've already removed everything all in one go. This is a method you are going to want to learn. You're going to want to be able to do all of it without having to clean it out. That way, when you're doing the ambulance time trials, which, trust me, you're going to hate when you get to that, you can do it all much easier by, you know, doing it all in one go instead of dropping the scalpel, picking it back up. It's a waste of time. Your time is very detrimental in those runs. Alright, so now that we've cut them out, we're going to grab the new ones, go down with L2, pick them up R1, and drop them in. Okay, that didn't hit the box. There we go. And as you guys can see, you'll get the trophy, Don't Test My Patience. And we'll go ahead and move on to the brain surgery. Alright guys, next we have up the brain surgery operations. We have 4 trophies we can earn here. Now, we'll go for an easy one first. On the left of the operating table is going to be a buzzsaw. Go ahead and grab that as quick as you can. And you have to kill Bob within 15 seconds. So just ram that into his head as fast as you can and hold it into place. Make sure it's hitting his brain. And if you do it in under 15 seconds, you'll earn the trophy, What Have I Done? We'll go ahead and hit retry. Now I'm going to show you how to actually remove the brain. So when we go to do the time trial, you'll be able to do it without any issues. The easiest way for me to get the skull off is just use the back of the hammer. It has a very good hitbox. So if you just barely drag it across, you'll see that it just literally removes the skull with ease. And it also prevents him from taking a lot of damage. So give him a little hammer massage. Literally just barely rub it against him, and even you can see, like, I'm not even really touching him, but it has such a big hitbox that it's still counting as hits. Sometimes it'll hit the brain. That's fine. You know, obviously when you're doing A++ runs, you want to avoid that as much as possible. But for now, it's not a big deal, and it shouldn't even cause that much blood loss to be a concern. So this next trophy we're going to do is actually called Nothing But Skull. It's a bit tricky. It's one of the trickier ones, but I believe you guys will get it. So we'll just slowly inch around. This is a very good method to get an A++. Otherwise, you can just smash his head open, which is a quicker way. Okay, once you've went all the way around, you can now see that his brain's exposed. In order to actually cut it out, you have to grab it once it's like that. Your hand might get stuck. Just try to get out, pressing R1, R2, whatever you need to get out. Now grab your scalpel of choice, which should be this one. Otherwise, I'm disappointed in you. And we will actually go ahead and cut his stem. That was a bit of a sloppy job, but that's fine. And what we have to do for Nothing But Skull is basically throw the brain in there. Now, the easiest method to do this is to roll it off your hand, because as long as you don't grab it after it's left your hand, that's what triggers the trophy. So if you hold R1 and R2 on it, kind of like you're bowling, I guess, and you just barely flick the analog forward and let it roll off your hand, and you let it bounce off, boom, you'll get Nothing But Skull. It might take a couple tries, but you guys can get it. Just keep trying. Now for the next 2 trophies, we're going to go ahead and retry. And so you don't have to do the time trial just yet, we'll do another easy trophy, which is to lose 50,000 milliliters of blood with the hammer, which is essentially like doing this 9 times, because you get 5,000 each time. So you can just keep banging the hammer on him. I will speed this up in the video for you guys, because no one wants to watch 10 minutes of me just fucking mutilizing Bob. Mutilating. Why the hell did I say mutilizing? Anyways, mutilating Bob. As you guys can see, you just do that until he's dead, and you just keep hitting retry to do it again. Make sure you let everything load before hitting retry. I notice if you're a little too quick to hit retry, the game does crash. So just to save you a little of annoyance, I figured I would tell you that. I've put in a lot of hours in this game, and it's always crashed for that reason. So just something to keep an eye out for. But anyways, I'm going to speed it up from here. and I'll let you guys know once the trophy pops.
Hands are doing. Oh golly, when you're on the trolley, trying to find the right tools like where's Wally? If I was you, I'd be crying for my mummy. I'd give you a tissue, but I've not got one on me. Sorry, I'm a little unprepared, but luckily you're not in a position to be running scared. Caught you unawares, anesthetized, now you're asleep, give me your teeth and eyes. What are you worried about? Who's scary? I'm just a new tooth fairy.
Alright guys, so after you've savagely beat the shit out of Bob with a hammer, and probably gave him Dane damage, you'll get the trophy Hammer Time. It'll take probably about 7 to 9 minutes. Now, after that pops, you're going to go for the time trial trophy. So you're going to hit restart. And in order to get this trophy, you have to do the brain surgery in under a minute. So we're just going to grab the hammer and just go nuts on him. Just don't worry about his blood. You'll be alright. Even if you just mainly hit his brain, you'll still be fine. It's not too hard. It might be your first kind of hard one that doesn't seem to have like a little bit of leeway on time. Don't be discouraged or nervous. You will get it. I believe in you. You're my apprentice after all. No, I'm just kidding. But go ahead and just get that out as fast as you can. Grab the scalpel. Oh my god, I'm terrible. After just calling you my apprentice. You're like trash. Why am I being taught by trash? No, but then after you cut out the stem, go ahead and grab the brain and pop it in. As long as you do that before a minute, you will get How Long Can You Live Without a Brain trophy. Alright guys, our next section will be the eye surgery, and I think you guys will do just fine. Alright guys, so you want to load up the eye operation, and we've got some pretty easy ones for you. Who doesn't want some easy surgeon simulator trophies, you know? So the first thing we're actually going to do is get the trophy, The Goggles Do Nothing, which is to just smash them. Instead of cutting them off with scissors, you just rub a hammer into them like that. Actually, you know what? If my memory serves me correctly, the hammer's not that effective, so don't listen to me. Grab the surgical axe and just bash that in there. That seems to be more effective. Just bash it in there. Don't worry about him. Bash it in there. Bash it in there. Bash it in there until it completely falls off. The trophy will not pop until you completely break the goggles. Which I will do at some point in my life. Not doing a very good job. Jesus, really? It's like hanging on by a thread. The goggles do nothing. So that's a pretty decently easy one. What you can do, if he's bleeding out a bit too much, just go ahead and restart the operation. Make it easier on you guys. You're still kind of learning the mechanics, and that's fine. The next one we're going to do is called Lumberjack. Now, what you want to do when starting this surgery to make your life easier, if you can grab these scissors in the box, fantastic. If it's easier for you to grab these ones, fantastic. Grab whatever's easier for you. You have two very good setup scissors, so whatever one is easiest for you to grab that you feel, I feel that that one is easier for me, so I went for those. But just grab whatever you feel is the easiest. You want to make this as easy as possible. Now, a lot of people drop the scissors and grab a scalpel and poke the scalpel in his eye. I find the scissors have a bigger hitbox, and it's much easier to stab the shit out of him in the eye with the scissors, which is what you need to do for this surgery. Don't think I'm crazy. There's a method to this. So, now that we stabbed one eye, we're going to go for his left eye now, which shouldn't be too hard, like I said, with the scissors. Now it's making me look like a liar. Now, there we go. Okay, once you do that, you're going to pull that out again, which might be hard because he can't seem to sit still. Go ahead and drop the scissors. And what you want to do next is grab a black box. Whatever one's easier for you to grab. There's multiple. If you don't want this one, I guess I'm taking this one because it's stuck in my thumb. No, but whatever one you want. And then what you want to do is just kind of grind it into Bob's face. Just keep smacking him with it. You can kind of rotate against it with your analog and it'll help. And that's going to actually pop his eye, well, eyes eventually, out of the socket. Now there is a trophy to get his eyes cut out with the Lumberjack axe, or the axe. It's called Lumberjack is what the trophy is called. So this one's pretty easy. You don't have to worry about his blood loss. You can just keep cutting his eyes. and that's fine. Just try to aim for the retina. That's the actual hitbox to get the eye off. The one under it is a little difficult to get, but when you're moving the eye around, it'll eventually let you hit it. Like that. I thought I would have hit it, but no luck. Oh, maybe there. No good. You'll get it, though. Just like that. And then you can rotate it and flip your hand this way and go L2 to go down and try to get in there and grind on his eyeball. There we go. You'll get the Lumberjack trophy just for cutting his eyes out with that. If he's bleeding out a lot and you're skilled enough, you can grab this syringe here. That's the green one that I've showed you in prior videos, or, you know, prior to this guide. And you can stab him with it, and now he won't be losing any blood. Now the other trophy we can go for. Oh, okay. The eyeballs fell off the table. So actually, you're probably better off restarting. Now the next trophy we're going to go for is called Heterochromia. And what that is we're giving him 2 different colored eyeballs. So it's a very easy trophy. We'll do this one and then we'll do the time trial. That way you guys can not have to dive into the eye time trial just yet. It's pretty forgiving on the time, but it's not really easy for newcomers. And once you put the scissors in his eyes and cut the goggles off like normal, what do you do next? Absolutely correct, class. We're going to grab the box and we're just going to slam it against his face as much as we can to just get him to cooperate with us. There we are. I find the scissors to be fairly easy for cutting the retinas. Just get whatever works for you. If you don't want to try the scissors and you already know more than me, try something else. Now, the scalpel's fine. Essentially anything that can cut is fine. I just do find the scissors seem to be easier, again, because of the hitbox. You'll get sick of me saying that, but, I mean, I honestly believe the hitbox on the scissors is awesome. As you've seen already. I've given you proof. You have video evidence. Except I do have an awkward hold on these. So what I'm going to do is actually switch for the... Oh, okay. What I'm going to do is actually just drop them like that. Give them a little bit of a rotate. And now I should have a better angle on them. Because the way I was holding them before... Yeah, that was not going to work. We're going to go ahead and cut the retinas. That last one's going to be a little awkward with this angle, but with Bob moving all over the place, but we got it. So now you want to grab eyeballs. And you guessed it. It's the bottle that says eyeballs on it. So what you want to do is grab that and go ahead and just dump them in this green tray. Or next to it, I guess, since I failed. You can kind of shake them out. Might be kind of stuck in there. Oh god, that one went flying. Okay, so we want to get 2 different colored eyes. So we're going to grab this white one. And they don't have to be eyes. There's like bowling pin balls, like a bowling ball and a smiley face eye. Like, I'd be fucking pissed if this was my doctor. But as long as it's actually different to the other eye that you put in, that's fine. That'll get you the trophy. I might try to grab this black one because it's in a fairly decent spot, maybe. We'll go down. No, the eyeballs are a bit tricky to grab. I kind of moved it over, and that was perfect. You'll see the eyes magnetize. Once they magnetize to the face, you can actually let go. That's when you know you've actually put it in. You don't want to let go and then drop the eye because you'll cry. And there you go, guys. Heterochromia, that's the trophy. Just 2 different colored eyes. Now we're going to do the blink and you'll miss it trophy. That is a time trial for this. You have to do it within 2 minutes and 30 seconds. I might go a bit fast. And I apologize for that. If you need to, you can slow down the video. But after doing it a couple times, you will get comfortable with it. And you don't need to worry about killing him or anything. You're not worried about rating. You just want to get the time trial trophy. So again, use the scissors. It has a great hitbox. And you will get it done quick. Boom, just like that. In and out. Drop the scissors. We'll grab the black box. We'll smash his face up. Sometimes this can take a bit, unfortunately, which will kill your time, but that wasn't too bad. if the damn box would get off me. The game's a bit dodgy, if you haven't noticed. Now we're going to grab these scissors. I grabbed the other pair of scissors for this part because they were in a better position since I just dropped the other ones that were previously in my hands. And we're just going to try to cut these out as quick as we can. We're only at a minute, so we still have a minute and a half. We're making great time. Bob's hanging in there. I'm actually really struggling to get this one right now for some reason. There we go. I kind of give it a little twist, a little flick of the wrist. And there we go. Too easy. We grab the eyeballs. We chuck them out. We get as much out as we can because they are fairly hard to grab. And we go down and we try to pick them up with R1 because it's just easier to put in that way as well. You will eventually grab one. There we go. And like I said, see how it magnetizes into his head? That's when you know to let go and you know it's safe and you're not going to miss out. That's a good grab. The more distance you can get, the easier it is for you to pop it in without worrying about dropping it. There you go, guys. Blink and you'll miss it, and we even got an A++. I'm proud of you guys. So now I think you're ready to move on to the tooth transplant, and it's not that bad, actually. You guys will do just fine. All right, guys, once you've loaded up the teeth transplant, you want to head over to this box on the right. You're going to go ahead and cut off the surgical mask. Now, this next trophy we're going for is fairly difficult. If you can't do it, you can move on. That's fine. There's no missable trophies in this game. Now, what this trophy is to remove all of the decayed teeth and only the decayed teeth. It's called You Can't Handle the Tooth. Now, what you want to do is pick up the scalpel to make it easier. It's a bit slower on removing the tooth, but you're less risky than the dental hammer if you're trying to get just the decayed tooth out. Which, boom, I got it out just like that. So now we're going to turn it right, and we're going to try to line it up against that decayed tooth. As you can see, it's a bit of a bad angle because I can't really see too much, but I'm guessing where it's at. And as you can see, I got it. I'm a trained professional. And we're going to try to get this last one. We're just going to move his face over to get a better angle. And don't be afraid to just slap him around and move him to where you need him to be. And it's a lot of precision in this. You just want to make sure you're not hitting any healthy teeth. If you hit them a couple of times, it's fine. If you do it too many times or get too good of a hit, you will knock them out. So we're just going to keep doing this. Just kind of gently tapping it, hoping that it'll fall out here in a second. And there we go, guys. We've removed only the decayed teeth. Now you can use the dental hammer to do it, especially if you have two teeth next to each other. But it is very risky considering you need a pretty high skill level. That would have been pretty cool if I caught that. But you do need a fairly high skill level. It's definitely not easy. Also, the teeth are just fragile. So once you have it in this position, what you want to do is go ahead and flip those open and grab the tweezers. Now these tweezers will let you implant the teeth. You don't need to match any teeth. There's 3 different types. They don't have to match. You can literally put this on the top part and he will have the most goofiest looking fucking smile ever, and that's completely fine. What you need to do is just replace all the teeth, and if you only replace the decayed teeth and you didn't remove any of the healthy teeth, you will get the trophy You Can't Handle the Tooth. I'm trying not to get 3 minutes on purpose for you guys, just so we can save the speed run next, because it's going to be much easier than this one, surprisingly. So we'll pop that last one in there, and as you guys can see, you get the You Can't Handle the Tooth trophy. Now we're going to go ahead and hit retry, and we're going to go for the next one. Okay, guys, once you've hit retry and reloaded, you want to do the same thing and grab those scissors on the side. Now this next trophy is called You May Feel a Light Tapping, and it is a speedrun trophy. And it's fairly lenient because it's 3 minutes, and I believe you guys can do it. So you want to use the dental hammer for the speedrun just because it is a little quicker. If you knock out his healthy teeth, it doesn't matter because you either got that trophy already or you'll get it later. This is just for the speed run. You don't need to be precise. I mean, if you can, awesome, but you don't really need to. As you can see, I knocked that one out pretty easy. I'll knock out one healthy tooth to just get these two out of the way, because they're pretty close to each other to where I can hit both of them. And as you can see, I removed all of them and including one healthy tooth. So you only have to replace the ones that are decayed for the operation to be a success. And we know that that middle one was a healthy one, so I'll try not to use that. I'm struggling to pick this up for some reason. It's almost like it's glitched. Okay. So I usually press R1 and R2 to pick this up because it's kind of dodgy sometimes picking up teeth and it won't actually pick them up, which would ruin your time. So now we just want to start popping them in place, and I put it in the one spot where there was a healthy tooth. The one that I didn't actually need. Anyways, that's not a problem. You have 3 minutes, so if you knock out a bunch of healthy teeth and you're unsure on which ones are decayed and which ones were healthy, just start putting in teeth like crazy, and you'll still get the trophy. Because like I said, I still have a whole nother minute left. And there you go, guys. It's that simple. You will get the trophy. You may feel a light tapping, and we can move on to the corridor surgeries. Alright, guys, so now that you've unlocked the corridor transplants, we're going to go ahead and start the operation for a heart transplant. All the transplants are the same from here on out. It's the same 5 ones that you do. And what you want to do for the corridor one is there'll be these trolleys that come by, and it's randomly generated. So you want to try to get these items, and I'm going to tell you what they are. There's the heart. You want to try and grab that and just set it on the trolley somewhere where it won't fall. So pretty much not like what I did. Oh, okay, it stayed. And then you want to get the buzzsaw. I was lucky enough to get both on the same trolley. Like I said, this is randomly generated, so I can only unfortunately help you by telling you what items I recommend you getting. Now, we have the buzzsaw. We're going to do the first 3 to 4 rib bones like we normally do for a heart surgery. Like I taught you guys, right? Right. And we're going to go ahead and cut those out. Oh, shit. We don't want to do that. That's fine, though. We're alright. You can. So this trophy is called Don't Even Need a Bucket, as well as Like a Hot Dog Down a Hallway, which is doing a heart transplant in a corridor. And we can't lose more than 4,700. So I've lost a fair bit, so I'm going to try to grab this green needle. And so I didn't prick myself. I grabbed it by the box, and I'm going to dump it out. Pro tip. And as you can see, we grabbed it, and we can't go under 4,700. I kind of did that a bit sloppy, which is fine. As long as you get the requirement, it essentially doesn't matter until you go for A++ runs. Now you want to grab a scalpel. So overall, you wanted the heart, the buzzsaw, and the scalpel. And if possible, maybe a green needle, just in case you mess up. Now, you can take as long as you want on the corridor one, so you can just sit there until you get every item you need and then start the surgery. There's no rush. If you go down on the hitbox, you will not hurt him. And then that way you don't have to worry about him bleeding out. So you'll cut his heart out. You'll know his heart is out as well because his heart will stop beating. You'll actually hear it not beat anymore. And we're going to go ahead and grab his old heart, pull it out. We're going to grab his new heart, and you got yourself a brand new bob. You just got to adjust it until it actually triggers and hits the spot that recognizes it. Like that. That's going to pop the trophy. Don't even need a bucket for doing the surgery without losing more than 900 milliliters of blood. And you'll also get Like a Hot Dog Down a Hallway, which is to complete the heart surgery on the corridor operation map. Now we're going to go ahead and hit continue, and we're going to move on to the double kidney corridor transplant. Alright guys, so go ahead and load up the kidney transplant. And this one is called Tunnel Vision. And in order to get Tunnel Vision trophy, you need to do a double kidney transplant with only losing 800 milliliters of blood. No more than that. If you lose any more than that, so basically if you go under 4,800, that's no good. You want to actually leave the kidneys in the icebox, otherwise they kind of glitch out and it's not good. So we'll go ahead and leave the kidneys. We're going to go ahead and wait for the items we need. There's a lot of waiting in the corridor, but I will tell you it's much better than the time trials. You want to never feel rushed. We're essentially looking for a good scalpel, which this will suffice. And we'll go ahead and start making incisions. If you can get a green needle as well, I do recommend it just because, there we go, green needle. So you want to set that scalpel straight down just like that and grab your green needle. And you can just set that on this little alcove kind of thing to hold it. And that should stay. Now you want to go ahead and grab the scalpel since you have that syringe there just in case you do mess up. And all you want to do is exactly what I taught you guys, and that's to go down on the hitbox with the scalpel, and that should cut fairly easy. There we go. He's only lost 3 mils just from that, so that's really good. If you just barely tap it, you probably won't even lose any. We're going to go ahead and hit this hitbox. That's the intestines there and the smaller intestines, and we're going to also get the stomach out of the way just because it does get in the way for me personally. And now we're going to actually try to get the kidney. We're going to do it all in one go because we have a syringe to stop blood loss. And we have 800 milliliters to work with. So as long as we don't go under that 4,800, we will be just fine. We're going to stab this kidney until it dislodges just like that. You'll see it barely move. So you do have to be pretty observant to notice that. But that's what you're here doing these medical exams for. We're getting you trained. We're going to go ahead and remove this liver. You just keep kind of grabbing it. It's not actually attached to anything. Like, you don't have to actually cut it is what I mean. But you do have to keep yanking on it and it'll eventually come out. So now we're going to go ahead and start pulling out his innards. And we'll go ahead and just grab this last bit and chuck it out. The rest is fine. We'll go ahead and grab his old kidney. And we'll say to hell with that. And we'll grab his other old kidney, which I believe I did cut out. Sometimes it might not register, or it might seem like it pops back into place, which I think that might be the case. So it's always good to keep your scalpel nearby and just rest it on Bob. And there you go. It's dislodged just like that, and I almost dropped the scalpel inside of him. Try to avoid that. Okay, so now we're just honestly going to be waiting for the kidneys to come by on a trolley. And that could be some time. So if you want to just knock shit off the trolley to, I don't know, for amusement, I guess, then do it. Kill some time. Eventually the kidneys will come by. No, they won't, because they want us to wait. I'm just going to move this so it doesn't fall in there for some reason. There really still isn't any kidneys. It's all randomized, unfortunately. So like I said, you could just be waiting some time. But if you just keep trying and you just wait and you be patient, you will get those to spawn. We're going to fly on over here. Kidneys, you son of a bitch. Ooh, I almost pricked myself there. That wouldn't have been good. Here we are. That's what we need, guys. So we're going to go ahead and quickly grab the right kidney and just kind of plop it in there as fast as we can, because you don't want the cart to go away and then you have to wait for the other kidney again. If you feel like you're not fast enough, don't try then, because you might drop it, and that's fine because they do respawn. That'll get you the trophy Tunnel Vision, and we're already going to the brain, guys. You're just slamming through this. I think you guys will be the next Nigel Burke. Alright, guys, so next you want to just load up the brain operation in the corridor. And for this trophy, it's called the brains of the operation. Now, in order to get this one, you want to do the surgery without losing more than 750 mils of blood. This cart's coming in fast, so we'll check the left side first. Essentially what we want to find is a green needle. You can find these in any order since they are randomly generated. So we're going to get the needle and the scalpels, because we're going to need that to cut the brainstem, right? So grab everything you would need for a brain surgery. Green needle is to just help you in case you accidentally mess him up too much and he's bleeding out, because this is a trophy to get a certain amount of blood loss. Now all we're missing really is a hammer tool. You want to use the hammer tool because it does minimal damage to him, and you won't have to actually worry about his state. Okay, still no hammers. We got a drill. We have our scalpel, our green needle, and our brain. I don't want to use the buzzsaw either. It's too dicey because if you barely miss, you are going to mess up this guy's brain and he will bleed. And you don't want that. There we go. That's what I wanted. So we're going to go down and grab this hammer. And we're going to do what I've told you before. Use the back end for the hitbox that it has. And just slowly rub around the head. And this will cause you to remove the skull without damaging Bob too much, due to that awesome hitbox on the back of the hammer. We're going to go a little bit lower because you don't want to have the skull too high and then not be able to pull the brain out. So that's kind of a ball buster. Oh god, I'm hitting his actual brain right now, which I'm not sure why. If you feel like you're hitting him a bit too much, you can try to go to another like area on his head. Like right now I should not be hitting him for this much blood loss because the hammer is really good for it. I'm just actually messing up. Even then, we have 750 mils to work with, so as long as we don't get down much further, we'll be just fine. He's bleeding out a fair bit, so what I'm actually going to do is just set the hammer down real quick. I'm going to pick up my green needle and just give him a little prick. That'll keep him from bleeding out so quickly, and I can just pick the hammer right back up, and I can go back to work on his head. The door slamming and things like that is a bit distracting, but you kind of get used to it after a little bit. But these ones are some of the easier operations, so you'll be able to knock them out easy, guys. It's more so about taking your time with these ones because you could make a simple mistake and then lose a lot of blood. Like right there, how I didn't lose a lot of blood, but I just smacked him straight in the forehead. And as you can see, we've actually separated the top part. Now the actual edges look a little rough, but they're not too bad. I'd say maybe just this chunk right here, just to save myself some trouble, which I'm literally just hitting his brain and not the actual skull like I need to. And there we go. That's what I was worried about. We're going to go ahead and pull this out. I'm going to actually give him one more prick, which isn't actually necessary since we're basically done. But if you want to just be safe, do it. The brain is showing its stem. You want to grab the awesome scalpel, my favorite one. And we're going to just bring this on home. We're going to go down, make sure we're not hitting him to ensure we don't lose more blood. And we cut the stem out, launch it away with the scalpel, and slam dunk. Oh, okay. That was anticlimactic. Slam dunk the brain in there, and you guys are done. That'll earn you the trophy, the brains of the operation, and we will move on to the eye surgery in the corridor map. Alright guys, so when you finish the brain one, you want to just load up the eye transplant in the corridor. This next trophy is called Won't Even Need Glasses, and it gives you a lot of leeway. You can lose up to 1,250 mils of blood. You will not lose anything remotely to that. You want to grab this jar, or whatever is there for you. If you can get one of these green needles for you without pricking yourself, we'll just scoop that out. And there's a green needle already for us. That'll be useful in case we accidentally mess him up. But, like I said, you get a lot of leeway with this one. If you can get scissors, I recommend it because of the hitbox, like I've said a million times. I know, a broken record. And what we're going to do is we're going to cut the side of his surgical goggles, like in the other eye surgery. It's the exact same surgery, just different circumstances. Why in these circumstances, I have no idea. So now we're going to go ahead and jab that in his eye. That didn't work. We're going to jab that in his eye. That still didn't work. And now we finally got it. So now what you want to do is pull that out, which might be a pain because he really likes it in his eye. And we will go for the right eye now. And we will go for the right eye now. And with a little bit of precision, we will go for the right eye now. No, right eye. No, right eye. And right eye. Wow, this one is terrible. Okay, there we go. So as you can see, we got both eyes stabbed and pulled out. He's lost a fair bit of blood. What we will do to prevent that is grab our needle that you should have grabbed before starting the operation. You want to make sure you have these needles. They will save you time. And now we want a black box, which we'll grab this one, which already has another needle in it, which we don't need. And we will just start slamming the black box in his face. If a black box doesn't spawn, you can also use a teacup and slam his face with a teacup, like that one there on the right side if you saw it there. It's that white one. And his eyes are out now. So what we'll do is we'll still use the scissors. I might just flip them like that so I can get a better angle on him. If you can't do that, that's fine. Just wait for a cart to come by and get yourself something new. But you'll learn little tips and tricks like that to just kind of make your operations go a little smoother. So now we got one more retina on this left eye here, and we're just going to try to go at it from an angle and like that, and that should cut it. There we are. And now we will go over here. And I've actually lost about 800 mils of blood, so I've lost a lot more than I would expect. So I'm not doing the best on this, but I will still be fine because it's 1250. Because now that I almost have this last retina, we can go ahead and drop the scissors. We can go ahead and stab him. He'll go back to 0. We can go ahead and grab the first eye, which you will need to grab the eyes off of a cart. I just got lucky and launched 2 of them on here. I mean, not really lucky. I planned it, obviously. And then just pop those in, and you guys are done with the eye corridor transplant. If it just, there we go. There you go, guys. Won't even need glasses trophy. And we can move on to the last one of the corridor, which is open really wide, and your tooth surgeries. Alright, guys, so you just want to go ahead and load up the tooth surgery for the corridor. And we're going to get the open really wide trophy. To get this trophy, you need to do the surgery without losing more than 550 milliliters of blood. When you start out, it would be nice to just kill some time by opening those up as best as you can. You want this green needle. If you find a green needle, try and go for it without pricking yourself. Oh, God. My anxiety. No, I'm just kidding. So we'll go ahead and launch that out. And now that we have that, we'll actually grab these scissors. And we'll go ahead and snip his surgical mask off. So you want scissors, a green needle, and tweezers. And then you're also going to want the dental hammer. Or I guess you could use a real hammer if that came by again, but I don't know. I guess you could essentially use that. I just didn't grab it in time. So if you see the regular hammer, you could if you're able to. But I actually did get the dental hammer, so I will actually drop it and try to get a better handle on that. It's not exactly what I wanted. I'll try to drop it again, and we'll go at it like an angle to get it to where I can use the back side. No, not working out for me. There we go. So we got a decayed tooth in the top left. We're going to pull that sucker out. That's a healthy one. Sorry, Bob. I'll put a nice shiny new one in there. Can't promise it'll match. Tough shit. So we're going to go ahead and smack this decayed tooth. That's out. And as you can see, he's losing a fair amount of blood. So after I get this tooth out, I am going to inject him. I'm only going to get this tooth out because I know I'll be able to do it in time. Or will I? Stakes are high. Can I do it? There we go. So we got it out. We still have about 100 mils to work with. So not the best run, but that's fine. We're doing alright. We'll stab him. Make sure he's at 0. And now we'll go ahead and grab our tweezers, which I will also drop and readjust because that was an awkward angle. Oh God, Bob, that's your mouth. I don't want your mouth. I want these tweezers. There we go. So now that we've grabbed the tweezers and he's not bleeding out anymore, we do not need to rush. We can just kind of take our time, start popping the tooth in, or teeth in, rather, and just kind of work our way around his mouth. Like I said before, they're really dodgy picking up teeth. Like, the actual controls seem to struggle sometimes on actually grabbing them. So what we'll do now is I'll open this one as well. Oh, okay. Well, that's alright. We'll keep using these. Sometimes using a different tooth will help it like stick to it, but these are still actually working, so it's not a big deal. So now we're just replacing these decayed teeth. I'm not sure which ones were decayed, which ones are healthy, but obviously those were it. And you'll get the open really wide trophy. That's it, guys. Now we are going to probably the hardest part of the game, the ambulance time trials. They are hard. Do not get discouraged at all, please. If you keep trying, you will get them. You are Nigel fucking Burke. I'll see you guys in the ambulance time trials. Alright, guys. So now you're ready. You should be ready. You got this. For probably the hardest part in this game. It's the ambulance operations, and you're in a moving ambulance. So what you want to do is go ahead and click ambulance and heart transplant, and we're going to get the first trophy called 999, and that's just to complete the heart transplant. I won't jump into the time trial one just yet, so you can kind of see how the ambulance one works and go from there. You want to immediately remove that if it stops following me, and you want to grab the buzzsaw on the left. Now you're in a moving ambulance. You will constantly be thrown around. Items will be going everywhere. I can't even grab the buzzsaw for an example. It's just you're constantly being thrown around. It's just what this one is. And I grabbed it kind of funny, so I'm going to have to actually drop it and re-grab it because it was actually glitching in my hand. So what you want to do is, again, cut the first 3 to 4 ribs for a heart transplant to do it the most efficient way. And you'll get stuff hitting Bob. I mean, it's a mess. You get thrown around. You can't control your hand. You might accidentally get thrown into him while buzzsawing him, or something like that. It's always something with the ambulance. So once you do that, you're gonna get rid of those ribs. Go ahead and drop the buzzsaw. Pull out the lung, and the scalpels are all on this left side. They're gonna be thrown around. So grab whichever one is straight enough for you to actually hit these hitboxes without worrying about messing up. And as you can see, we got those no problem. And I'm going to actually wait a little bit so I don't do the time trial, just so you guys can kind of see how it is. And you go ahead and grab the heart, and we will drop it in just shortly, and we'll drop it in now once it stops shaking. There we go. And as you guys can see, 999 for doing a heart transplant in the ambulance. Now we're going to go for life's too short, which is the time trial. You need to do the heart transplant in under 1 minute and 40 seconds. So immediately throw that off. Try and come down here and grab this without messing up. If you can get it first try, that'll be good on your time. You don't need to worry about damaging him or your rating because, again, it's a time trial. Any time trials, you want to just get through them as quick as humanly possible. So we'll just grind right here, Even if you're hitting him, again, it's fine. Just try to get the bones. Get the bones. Awesome. We're making good time already. Now you're just going to try to grab the lung. If you grab bones, just keep moving. When the ambulance moves, it'll actually move some of that out of the way for you. And then put a hammer there instead. No, but sometimes it can be helpful. Now we'll go ahead and throw that out. And we will grab the scalpel. We're going to cut this. The times are also not very forgiving, especially since you're being thrown around. So we got it out. We have a minute. See, it knocked the old heart out, though. So see how it helped us there? Because now all I have to do is drop it in without having to worry about the old heart. And we have plenty of time on the clock, guys. Life's too short trophy. You had to do it in under 1 minute 40. We got 103. That's it, guys. You can slam this out. Keep trying. Do not get discouraged. Alright guys, so after you do the heart one, you want to just load up the kidney one now. And this one is immediately a time trial, so unfortunately we have to get right into it. If you need to, keep watching it. This one is called A Surgeon's Merit is Based on Speed. You have to do a double kidney transplant in under 2 minutes. It's very, very unforgiving. Grab the best scalpel in the game, hands down, and you will get this shit no problem. So we're going to hit this hitbox right here in the right corner. We're not really doing too well off the bat. That's fine. We'll keep going, see how we do. And it's going to move you around. You're going to mess him up with the scalpel. That's completely fine. Try and realign yourself and get back to cutting. Don't let it throw you off for too long. You have too much time that you can't waste. Too much precious time. When he hits the gas, it should knock all this stuff out too, which is fantastic. So what you want to kind of try to do is cut the kidneys and everything out in one go like you would normally, like I taught you. Because when he hits the sharp turns, all of this stuff is going to go flying out. And if it doesn't, you can try to start moving it out of the way, because you will need it out of the way regardless. Otherwise, it's not going to register your new kidneys. So we got 50 seconds left already, guys. It's a very intense surgery. We got these out. Now we pretty much just want to grab the new ones. You can kind of guess which one's which. I believe they even actually play as both parts. See how he hit a speed bump? They're hopping around everywhere. They can also be launched back out. So you want to try to be quick with this before he messes up. And boom, guys. And you even got A++. A surgeon's merit is based on speed. That's for doing it in under 2 minutes. We still had 27 seconds to spare. You guys can do it. And I'll catch you guys on the Brainstorm one next. Alright guys, after you do the kidney one, go ahead and load up the brain. I'm actually surprised I did the kidney one in my first try while recording, because it usually takes me at least a couple. So that's pretty good. I'm Nigel Burke. No, but anyways, this one's called Brainstorm, and you have to do a brain surgery in under 1 minute and 30 seconds. So you want to immediately grab the hammer and just start bashing away as much as you can of his skull. You want to do as much as you can because you are definitely constrained for time. Try to make sure you get in the front as well, because you want to kind of keep rotating the hammer to hit all angles. The car will also throw you around, which is good because it actually throws you into his skull, making it a little easier to hit. We'll go ahead and keep smacking that around. And as you can see, oh my god, he's lost so much blood. You might even have to hurry up and grab this if that happens. Stab him a couple times. Don't take too long because, again, you have 1 minute and 30 seconds. So we got about 50 seconds left on the clock. I don't know how to math. That was actually 40 seconds. And we're going to go ahead and grab the brain, and we still did it like nothing, guys. That's the trophy Brainstorm, and we will go to our eye surgery ambulance next. Alright guys, so after you finish the brain transplant in the ambulance, you're going to go ahead and click eye transplant. And we're going to go for the trophy called I Can See for Miles per Hour. 2 minutes and 10 seconds is the speed run time. You want to grab the scissors on the bottom right and start cutting away at the surgical mask. Those are at a good angle for you to grab, so grab those ones. Cut the mask off and then start jabbing the scissors into his eye. Remove the scissors from his eye and then stab his other eye once that actually lets you. And you're going to have to try and do it while the ambulance is shaking. It's not too bad. We're making pretty decent time so far. We'll go ahead and drop that. You're going to pick up the black box that's on the left. That first eye came out really easy. Sometimes that'll happen for you. Other times you'll beat the shit out of him for an hour and he still won't pop his eye out. But hopefully that's not the case. We'll get this other eye out hopefully soon because that's a pretty good run. And we'll grab a pair of scissors. These are in a good spot and a good angle because they're facing forward, which will allow you to hit multiple angles for the retina since there's 4 actual retina cords you need to cut. So I'm going to try to tilt that to get that one out, and that actually worked. And now we're going to go ahead and tilt that to get this one here. And then there's one under it, which I just got, and now that should be out. So now we have to actually grab the eyeballs. They're up here on this top shelf. You want to go ahead and try and grab that. I grabbed 2 at the same time because I'm a motherfucking boss. No, I'm just kidding. So now we want to actually grab the eyes. This can make or break your run right now because the ambulance for me is fucking shaking everywhere. He just shook out more eyeballs though, so the driver inadvertently helped me. Stupid jackass. So as you can see, we have 2 minutes and 10 seconds we need to beat, and we're about to finish it. We just need to pop this one in, and I dropped it. I choked. So what we want to do is try to grab another one with the last bit of time we have left. Otherwise, we fail, and we cry. Oh, I got that perfect. Pop it in, and as you guys can see, I can see for miles per hour. That's the trophy, guys. We're going to head over to the tooth surgery next, and then you can get the fuck out of this ambulance, because trust me, I want to kill myself too when I do it. Alright guys, so once you finish the eye transplant, we're going to go ahead to the teeth transplant on the ambulance, and we're going for the trophy called Not the Time or Place for Precision. You have to do the teeth transplant in under 1 minute and 50 seconds. It's not too bad, but we're going to basically grab the scissors on the bottom right, and we're going to go and cut off the surgical mask. Wow, I got 3 decayed teeth in a row. What the fuck is going on? Should I try to win the lottery? So that's pretty, like, I don't know. I don't see that often, so that's awesome. We're just going to smash his face right there. And you might not get that lucky. Well, you probably won't. And you can keep restarting until you do get lucky, and you will eventually get it, regardless. I'm struggling to get these open, actually, which is ruining how great of a setup this was. But that's fine. We got them now. We're going to start putting in the teeth before the ambulance starts crashing into shit. And we're going to just start popping all these in. The ambulance is going out of control right now. You want to make sure you don't hit his face while you have a tooth when you lose control, because you will drop the tooth. 9 times out of 10, you will drop it. We're going to move the fire extinguisher out of the way because it's actually preventing me from grabbing teeth. And I don't want to lose this perfect setup. So, boom, just like that, guys. Not the time or place for precision, and even got A++. I'm proud of you guys. So, now we can actually go to space, and I'll show you guys how to do that next. Alright guys, once you finally got rid of those hellacious ambulance time trials, and you're back at the main menu, you're wondering, wait a sec, why can't I go to space? Well, in order to do that, you're going to go over to the left on the receptionist desk, and you're going to eject this floppy disk, and you're going to pop in this one that has question marks here that's all black. And just pop it in there by moving close to it. You'll get a message from these aliens. And this is actually going to give you a trophy for unlocking the space operations. Space is pretty easy. It's just a matter of getting used to the perception because of the gravity. So when you go to grab a scalpel, you might think you're actually in the right spot, but you might launch it across the map. So there you go. You see space trophy. And now what we're going to do is we're going to go down, and this is for 2 trophies. It's life, Jim, but not as we know it, as well as the trophy in space, no one can hear you bleed. Now, what these trophies are is one is just a blood loss, and the other is just for doing a heart transplant in space. Now, in order to do this without losing much blood, you just want to use the buzzsaw to get the 3 to 4 ribs like we usually do and avoid doing what I just did right there. Not really sure what happened. I kind of just got sucked into his stomach. But it didn't really damage him too bad. You want to just kind of grind that off. And you have 800 milliliters of blood to work with, so you just can't go under 4,800. It'll be really easy. So we're going to go ahead and knock that out of the way, and we're going to grab the lung to move that out of the way. And you want to grab a scalpel. Now this is the best one to grab in my opinion, because you just line it up and you grab it just like that, like a professional. And that's the easiest one to grab. If it floats off or you need to grab something else, just feel free to do that. Find yourself a scalpel. If he's bleeding out because you didn't cut it very well or anything like that, there is a green syringe floating around. There it is. It just stabbed me in the goddamn hand. So I'm going to prick myself to cure myself, which I don't think worked because I can't really see. I think that was it actually. No, that's the slow down one. Okay, I'm just going to finish this. If you prick yourself, you can actually undrug yourself by going to the blue needle. But I'm going to finish this surgery so that way I'm not doing this while drugged. But basically, if you need to drug him so he doesn't lose blood, find the green syringe and you'll be fine. I think that's the blue one. I kind of want to cure myself now. There we go. So that'll cure yourself if you ever do drug yourself. You want to just push it inwards and then drop it in. The hitbox is harder to reach because of the gravity, but once you slam it down, you will get the trophy. It's life, Jim, but not as we know it, as long as you didn't go over 800 mils blood loss. And in space, no one can hear you bleed. So next we've got the double kidney transplant in space, and I'll show you guys just how to do that. Alright guys, so once you finish the heart transplant in space, you're going to want to click kidney and start it up. And this trophy is called the Surgery of the Future. And you have to do it without losing 700 mils of blood. So thankfully you're done with all the time trials. Now you just have to do the easy stuff. This is another scalpel that's easy to grab. You just go up on it like that, and you're on the same level of height as it. So all you really need to do to grab it is just R1 as you approach it. And then you want to just hit the hitboxes that I've told you plenty of times now that we're getting close to the end of the game. And we will hit all of these. We'll try to avoid from getting him to bleed out, but it does happen because these hitboxes are a little dodgy. And they're also just kind of hard to hit due to where they're at. Can't really see. There we go. Best thing about space is those will go flying right out of him. Except for it's blocking my damn view. That's alright though, we're good. So we're going to go in and we're going to actually cut this stomach. We're going to cut the kidneys itself. Just like we would always. Just cut everything. Make it easy on yourself. I haven't seen this one dislodge yet. There it goes. I'm actually really messing him up, which is fine, because I'm almost done with all the kidneys being knocked out. And that kidney just moved out of place. So you have 700 mils to work with, and we actually want to try to grab that right now, which we did perfectly. So proud of us. And we will let go of that and make sure it doesn't hit us. And we will move all this crap out of the way. And we'll take out his liver. And we'll take out the kidneys. The kidneys are kind of a pain to put in with gravity because they kind of float around. So what you want to actually do is go ahead and go to the ice box. Grab the right kidney. And just slowly kind of drop it in there. And the gravity will launch it down. And by the time you come back with the left, you'll be able to catch it so it doesn't fly away if it does fly away. And you just want to try to tap them into the hitbox. That will actually complete the surgery. And as you guys can see, it's that simple. You get the surgery of the future. Just line up those kidneys, and that kidney flew out anyways, but it doesn't matter because we got our trophy. So we'll go ahead and head for the brain surgery in space, and I'll show you guys how to do that one. Alright guys, so what you want to do is just load up the brain operation after you've finished your kidneys. And for this trophy, it is called Precision Instrument Time. And what you need to do is to do a brain surgery in space without losing 600 milliliters of blood. Now you want to do the trick I've taught you from the beginning because it works. And if it works and it's not broken, you don't fix it, do you? So what you want to do is grab that hammer, use the back of it as a device to reach behind his head of some sort. You just want to reach with the hammer, and I think that's all brain right there, so I'm just really tearing his face up. We're going to move over and try to hit just the skull. There we go. Now we're back to just hitting skull, which is what we want. We don't want to hit his brain. And you just want to keep using the back of that hammer to get this all exposed. And it might knock you around a little bit, so just be careful where you're actually slamming the hammer at, because you might cause him to bleed out, and that just makes it more problems for you. So you have 600 mils to work with, so you can't go under 5,000 mils. If you go under 5,000 mils, you will not get the trophy. And we will almost be done now. We've got almost all of this off. We're just going to kind of rub away at that and rub away at that one. We're going to go ahead and smack that part, rub away at that. And there is a piece of bone back here that's actually keeping it held together. And there we go. Just like that. That should be alright. I might even actually, just because he's not bleeding out too bad, might just try to trim up his skull right here, just to make sure I don't have problems with the brain coming out. Now, if he is bleeding out big time, you can always find your trusty green needle and give him a jab. Now we need to actually extract his brain. And again, my favorite, scalpel to the rescue. We're going to go down just a little bit and grab it just like that, guys. I'm telling you, the best scalpel in the game. Fight me if you don't agree. No, you don't have to fight me, but it really is. It's amazing. So that's it, guys. You will grab the brain after that. It's so amazing. It's still trying to stay with me. So grab the brain, slam it in there, and that'll net you guys the trophy. Precision instrument time. So now we're going to head over to the eye surgery in space, and I'll show you guys how to do that one. Alright guys, so after you finished your brain surgery, go ahead and load up the eye transplant in space. We're going to get the trophy Expert Space Stalker. And they're so generous to give us 1,000 mils of blood to work with. So you can go ahead and mess him up for 4,600 until he gets to there. If you go under that, you lose. First thing you want to do when you start actually is to move this blue needle away from him. If that stabs him, he will start bleeding out like crazy. Then you want to grab a pair of scissors, preferably one that's at a good angle. That was good enough for me to get these goggles off, I'm sure. And then they'll be good enough for me to stab him, where I can actually reestablish a better grip on them after I need to pull them out of his eye. So now that his mask is off, we will jab that in his eye, which is so easy with the scissors because that damn hitbox. And we'll go for the left eye. Too easy. Pull that out. Never mind. He's a stubborn little bitch. No, we'll pull that. No, he really is a stubborn little bitch, isn't he? Okay. So we got that out. He is bleeding a little bit. So since we're not carrying anything right now anyways, we're going to try to grab that, but we don't have a good grip on it. Oh god, and we don't want to get stabbed by it. Oh god, and we're launching it all over the place and we're doing crazy shit with it. Okay, it slowed down. We can get it now, maybe. That's what I mean about the perception. It's going to throw you off for some time. I've put a lot of hours into this game, and even still the perception isn't exactly 100%. So we're going to go ahead and grab the, oh okay, we were going to grab the black box, but now we're going to grab the teacup, and we are going to smack Bob with it. Just go ahead and keep smacking him with it until his eyes pop out, just like we normally would. And any minute now, his eyes should come out. There goes one of them, and there goes the other. Too easy. So now we're going to try to find a good pair of scissors, which would be this one here. If I don't mess them up, I grabbed them. So now I find it easy to cut the eyes in space due to the gravity. So what you want to do is just slowly inch at the retinas and cut them away. Cut them away. And his head will actually float the eyes kind of around. That way you can hit every angle pretty easy. That one might be a little funny. I might be able to come at it from a side angle like that. No, but that's fine. Now we can probably come from under. And that's exactly what we'll do. We'll go from under and we'll try to slice that bit off. And that didn't even work. Awesome. So celebrate. No, but we'll just keep trying on that eye. If anything, we can even switch this eye. Maybe give us a little break from that eye since it's not wanting to cooperate. And we don't want to sit there and cause him to bleed like a crazy amount. You have 1,000 to work with. So you do have a lot of blood that you can lose. It's a very generous one. It's a very easy one. It's just a matter of being able to cut those hitboxes when they come into range. Like that should have registered as a hit, but it didn't. So that's alright. We'll keep going. If you find that like maybe that's still struggling a bit, you can kind of like set the scissors down or the scalpel down and kind of get a better angle like that. And then go back in for the kill and be like, you little bitch. You thought you were getting that eye from me? I'll take both of those eyes. No, but you can kind of just get a better angle, and then this thing will fly from the sky because it knows you need it. No, that's not actually how it works. I just kind of got lucky, but I'm not getting a good grip on it, and it's causing me to throw it around. But that's fine. We grabbed it. We still have 361 milliliters of blood left that we can use to our disposal. We can grab the eyes from the vase over there, or the jar, whatever you would like to call it. I guess it is more of a jar. And we will grab the last eye, which is in an awkward grab stance. So we're probably going to have to let go of that one, because that was a bit awkward. We'll probably try to grab it again. Nope, so we'll just go back into the jar. We'll go for another eye. And that one didn't work. We'll go for one of these eyes maybe. That didn't work either. We'll go for that 8-ball eye. That's not working either. You can keep reaching in there. Really try to get an eyeball. We just need Bob to see again. Those eyes are no good. I think that eye is out of range. This eye just came up, so that might be a good one to try. And I lost it. I think we may just have to go and try to work our magic in here. That's just sometimes how it is. So what we're doing is having our vision obscured by a damn radio. And once we move that radio, we can actually grab our last eye and be done with the eye transplant, just like that. Or maybe I'm getting ahead of myself. I'm really trying, guys. He won't accept my offering of vision. Really though? Am I like not positioning it properly, or we might have to grab another eye. There we go. Just play with it. It'll go in. You'll get Expert Space Stalker, and then we can move on to our last surgery, which is the teeth surgery in space. And I'll show you guys how to do that one. Once you guys have finished the eye surgery, you can go ahead and click the teeth transplant in space and start that one up. This is actually going to get you 2 trophies. The first one is going to be maintained healthy gums, at least. And that's to do the teeth transplant in space without losing more than 600 milliliters. Now, what we're going to do at the start is we will grab a good pair of scissors, which is the bottom left. That was a bit slurry. I've actually been doing this guide all in one sitting. So yeah, if you guys could smash like or show some support, I would appreciate it. Or if it's helped you, or if you need more help, just message me or leave a comment and I will help you guys. But to stay back on topic, what we'll do next is, now that we've removed the surgical mask, we are going to grab the dentist hammer, which I'm slowly rotating so I can get a decent grip on it. And I'm not actually doing too well. I might actually lose it right now. No, I grabbed it. But I still need a decent grip, so I'm going to let it rotate. And hopefully I can get... That's still not quite what I wanted, but that might work. And what we want to do is just smash away at the decayed teeth. We're hitting healthy teeth too, which is fine. You really can't fail this one, and by can't I mean you obviously can, but it's fairly easy. Like, as you see, we've already almost got all the teeth out, including some healthy ones, and he's barely taken any damage. Bob's a trooper, really. At this point he's used to your kind of torment. So what we want to do is just try to get this last one, which is in kind of a little awkward spot because of how I'm holding the dentist hammer. But you know, we'll get it, as we just did. And now you definitely want to look for the green syringe, especially if he's bleeding out. That's the blue one, so we're going to keep looking around. We're going to look around, and there it is. We're going to try to go and grab it. We got an awkward stance on it, pricked ourselves, and now we will go cry. No, we won't. We'll just go ahead and find the blue needle, and we'll stab ourselves with it. If I can do that. It's kind of messing with my vision. There we go. And we will try again. Now, it should be floating back down any second. But in all honesty, he's not bleeding out too bad. So in my case, I might not even need it. If yours is bleeding out, you definitely want to try to find that if you need it, of course. If you don't need it, just finish the surgery. There's no sense in not doing it. But now that it's actually come down and I didn't grab the tweezers in time because I was a failure, I will stab him with that, and we will easily get this now unless like something flies into Bob's face and just mutilates him. So now we got the tweezers, which is the last thing we actually need. I'm a little uncomfortable with all this stuff floating around his face like a big giant saw. So we'll move that with my arm. We'll move that as well, which is kind of being stubborn. That's okay. So we've moved all of that stuff out of the way, and Bob closed his goddamn mouth on us. Like, hey, we're not trying to operate here. That's fine. We'll figure it out. I'm gonna grab these because these seem to do pretty well. They have a pretty decent sized hitbox or hit detection for inserting them. Even if you just set it there, it'll just magnetize to it. It's really great. And you're just going to fill all his teeth back in. Assuming you didn't smash all his teeth out like I did, it would be a little easier for you. But you can't lose this one. Once you're got his teeth out and you make him stop losing blood with the syringe, it's an easy win, guys, from there. We're going to try and catch that one in midair. Ready? Nah, too far. Ah, come on. Come on, guys. What's going on? Bob's trying to make me look like amateur right at the end. So we're going to try to grab that one, if it'll let me. It's kind of in the corner. It doesn't really like that. It's fighting it, and we got it. And it's actually right around there, if I'm not mistaken. It's right around there. And there you go, guys. You'll get the Maintained Healthy Gums, at least, trophy, and the Practically Licensed trophy. That trophy is for completing all of the different types of procedures. So you guys are now completely done with space already. Awesome job. I'll show you guys what you have left to do, though. So now that you guys are a bit more professional at Surgeon Simulator, we're going to knock out a little bit of an easier amount of trophies, just to kind of still, you know, improve your skills, so to speak. We're going to go back to the main operating room. We're going to go to heart surgery, and we're going to get a trophy called I Immediately Regret That Decision. And you have to be fairly quick because this is going to be 2 trophies in one. You want to drug and electrocute yourself within 20 seconds of the start. So you want to move over there, slam your hand into the drug needle, and then go ahead and come over here and grab a scalpel really quick. If the hammer's in the way, just chuck it. And as you guys can see, I electrocuted myself in the socket up here, and that gave me the I Immediately Regret This Decision. And now there's another trophy to complete this surgery. While you're drugged, you want to complete the surgery. So we're going to grab this buzzsaw over here, if we can just scoop it out of the corner since it fell over there, which we probably can. It's just being a little stubborn. We'll keep inching it away, and we got it. So now you have to complete the surgery while drugged and electrocuted. As long as you did that within 20 seconds of the start, you'll get the trophy. If you did it and it took too long, it'll void you from the trophy. So we're going to go ahead and cut the rib bones out. If you mess up, it's not a big deal. He'll live through a lot. The vision is kind of obscuring, but you'll be okay. You want to go ahead and grab the scalpel after you've opened the 4 ribs. And then you want to go down on the hitbox I showed you. It might be a little hard due to the vision, but you will get it. And as you can see, too easy. We got the heart out. We just need to actually pull it out now. And we're going to go ahead and grab the new heart and pop that in. And that is also going to give us another trophy, which is, if this actually recognizes, I'm not in the right spot apparently. There we go. Okay, even that's not it. Come on. You gotta work with me here. Pop it in. Really though? Do you not want a new heart, Bob? I'm confused what's going on. So we'll kind of slam that in there. And it's still, there we go. And as you guys can see, you'll get the trophy. And they said it was impossible, which is to do a procedure while still drugged and electrocuted within the first 20 seconds. The easiest one to do that is obviously the heart surgery. And you could probably do the brain surgery if you feel more comfortable with that. But those are 2 options for you there, guys. And we'll go on to the next trophies. While we're at the heart transplant, we may as well go right back into it. And we're going to get 2 more trophies from here. They're pretty easy ones. And the one we're going to go for now is called I'm Sure He'll Live. And you have to complete a transplant. My freaking hand's stuck in his ribs. You have to complete a transplant, basically the whole operation, with only 10 milliliters of blood left. Now, you may be thinking, what? That sounds ridiculously hard. Well, you're wrong. It's actually really easy. And I hate to say that you're wrong because we've been through a lot together. You know, we've just been going for this plat together, and it's been a journey. So I don't want to say you're wrong. But if you were thinking that, you are wrong. If you weren't thinking that, then awesome. This is why you're my apprentice. But no, anyways, just continue to pull out the bones, the ribs, and then pull out the lung. And then you want to cut the heart out. And what you're going to do to do that is grab the scalpel. You're going to cut those hitboxes as I've showed you a million times now that we're experts. Chuck the scalpel away. We're going to go ahead and grab this heart. Clench your hand with R1 and R2 if you can't get in there. And now, before putting the new heart in, what you want to do is grab this buzzsaw and just place it on Bob's face. Just gently place it. Now what you're going to do is... Oh god, that was kind of dodgy. You're going to do this until, if you're quick enough, 1,000. If you're not comfortable with your speed, I would say 1,500. And essentially, you can do it at any point, but you could even stop right here and then go get the green needle. And then what you want to do is just let it bleed out, and go ahead and start pricking him at about 500. Oh god, I should have probably done that sooner. Oh god, I'm panicking. No, too easy. I'm a professional. So you want to basically stop him from bleeding out before he dies. If he dies, you have to restart, unfortunately. So now, when you get him low, you have to get him under 10 milliliters. The best way to do that is to use the syringe to actually damage him, because it'll also keep him from losing blood. So you're going to keep just gently tapping it on his face. You don't want to do it too hard because it can do big chunks randomly if you hit him too hard. You're just going to keep doing this until you get 10 milliliters or less. Oh god. You see what I mean? How that just jumped to that? So he has 5, which is still more than enough. I'm in no hurry. And now we'll just drop the heart in. And it won't register because why would it? No, but you just mess with it. It'll eventually register and it'll give you the trophy. I'm sure he'll live. And then we can go for another easy trophy by hitting retry. And this is yet again another heart transplant trophy. So they're all pretty easy. And what you want to do is grab the buzzsaw yet again. And you're going to cut the usual ribs that you do. And the reason why you have to retry and do this is because you can't get this trophy at the same time as another trophy. Otherwise I would have combined them and made life a little easier. But you do have to do these separate, unfortunately. So they're really easy though, and we'll get them knocked out quick now that you guys are experts. We'll move these bones out of the way. And again, we're just doing the same thing we always do with the heart transplant. We're just getting in there. If I can grab the lung. The lung will move all that bone and whatnot in the way. And now we're going to go ahead and grab the scalpel to cut out the heart. When you cut out the heart, with the hitboxes there and the bones in the way there, but that's fine. We'll still cut it just fine. And then we're going to go ahead and go in and grab the heart. Now for the trophy, it's in. It's in, I tell you. That's what we're going for next. And what this trophy is you want to have the heart in him, but you want to have it in there incorrectly. So the best way is probably upside down. Then you can just drop it in there and see how it's sitting in his body. As long as it's sitting in his body, you should get the trophy. If it doesn't pop, it just didn't register and you'll have to try again. It's a bit of a dodgy trophy. And all you have to do after you have it in place, you have it in his body and it hasn't registered as complete, you want to grab the buzzsaw and just grind it in his face. The goal is to basically have him die while the heart's in there, and you'll earn it's in, I tell you. So we'll go ahead and let him bleed out. We have the heart inside his body upside down. And we'll go ahead and just let him slowly die. And if you did it correctly, guys, you will get the trophy. It's in, I tell you. And then we can go ahead and move on to our next lot of trophies. So go ahead and hit back to menu. Now that you guys are back on the main menu, I've got 2 more easy trophies for you guys. Why not? Let's get a couple more easy ones knocked out while we're at it. You want to go to space, and then you want to go to the brain. Now once you're in space and the brain operation, you're going to notice in the top right area of the map, there is a keypad. I'm going to put the number on the screen, but the number you want to dial is 2. And you're going to have to mess with this. It might take a while to get used to. If you mess up the numbers, you can just spam them until it gives you an error and then retry the actual right number. So 296 1 4, and we want to go for 5. Once you hit, oh, okay. Well, that's how you fail it if you mess up. So we're going to go 2. Should try to do that a little quicker so I don't keep you guys waiting. So we got 296 1 4 5. The second you press that 5, you want to look for the radio because you need to grab it. If you don't grab it, you won't get the trophy. But once you enter that code, you'll get the trophy. Enter the code. And if you grab the radio in time before you get sucked into space, when you get sucked into space and you're carrying the radio, you will unlock the other trophy called We're Going on an Adventure. And that's it, guys. 2 very easy trophies and that much closer to that sweet Surgeon Simulator Platinum. So I'll show you guys what trophies to do next. Alright guys, so I got 2 easy trophies here for you. They're fairly easy anyways. The first one is called Let's See That Sick Filth Again. And what you want to do on the reception desk is just show me your spoon flipping skills by doing a 180 degree spoon flip. And the best way to do this is have your palm facing up. You're going to press left on the right analog just a little bit. You're going to let go of R1 and you'll press R1 again to catch. And you'll just keep doing this until the actual trophy pops. We'll knock that back off of the menu. We'll try again. That was horrible. Absolutely terrible. You can hit reset reception if you drop the spoon or it goes somewhere where you can't access it. And it's just going to reset the reception desk exactly how it was before you fucked it up. And we're just going to keep trying. We're just going to keep spoon flipping and catching. That didn't even count as a catch, so I didn't get it there. Otherwise, I think I would have had it. That would have probably counted. That was it. There we go, guys. Let's see that sick filth again. So just keep throwing it around like that, and you'll eventually get it. Now, the next one is called What a Load of Bull. And you have to get the Surgeon Simulator rap to play on the radio. And the easiest way to do that is pick up the radio and just smack it into stuff. And there you go. As you guys see, you got the trophy, What a Load of Bull. And now you can just sit back, relax, and listen to the rap about Nigel Burt. But anyways, I'll show you guys the next trophy you can get here. Alright guys, so from the main menu again, we have another trophy we can do here. And this one's fairly easy now that you're a master of the controls. And I know you are, because you made it this far in the game. You have huge balls. And if you're a woman, you have huge lady balls. You've tackled a lot, and now what we're going to do is we're going to call Trisha. And in order to do that, you got to take the phone off the actual receiver, and then you see this pencil here, you're going to kind of go down on it and pick it up. And I didn't get a good actual grip on it, so we're going to go again, and we're going to try to pick it up. It's probably better that it's back in that corner, and there we go. So once you have a good grip on that, you're going to dial her number, and I'll put her number up on the screen now. And what you're going to do is you see that shadow of the pencil? You're going to use that to guide yourself. This will make this trophy much easier. Now, you're going to hit 0, 9, 9, 3, 2, and you're just following that shadow. Wherever that shadow goes, that's what button you're going to press. 6, then you've got 0. You'll also hear a beep to show that you've actually hit the number. We have 7. We have 1. Then we have 8, which we'll go ahead and line our shadow up again so we don't hit the wrong button. And then we have 5. I don't know why the hell she doesn't have a normal number like the rest of us. And 0. Once you've done all of that, you can go ahead and line the shadow up with the call button. And you can give her a call. And you can bitch her out for having a ridiculously long number. There you go, guys. Call Trisha trophy is now done. We're getting close to the end here. I want to thank you guys for sticking around. And let's go ahead and keep going and get you that platinum. Alright, guys. So you see this star up here. You're probably wondering how you unlock this. Now, if you remember, we entered the code on the brain surgery and we got sucked into space, basically. That's going to make this VHS tape spawn. If this VHS tape is not here, that means you need to go back to the brain surgery in space, re-enter the code 296145, and that'll give you the, it'll suck you back out to space, and when you come back to the main menu, this VHS will be here, and you'll try to put it in this VHS player whenever I can do that. There we go. And you will see a code. That code is 4948. And I will have that on the screen for you as well, just in case you forgot. And now we actually have to do a surgery on an alien in space. So you go 4, 9, 4, 8. This is going to pop the trophy, Screw the Prime Directive. And that's for finding your first alien patient. So here we go. Here's Alien Bob. And we have to perform a Gobbleshaft transplant. But instead of doing that, we'll get another easy trophy out of the way. Just grab this shuriken type thing, which isn't spinning properly because of what I'm holding it by. So try to grab it from the proper thing to actually hold it with. What the hell? I'm not having it. There we go. So now what you want to do is break all of these canisters within 10 seconds. If you don't do it within time, you will not pop the trophy. And if you did do it in time, you will get the trophy. I have no idea what I'm doing. And after that, just go ahead and hit restart, and we'll go ahead and get our other trophy. So there's another 2 trophies out of the way, really easy ones. We have 3 trophies left in the game, guys, and you have the platinum for Surgeon Simulator. You can like officially call yourselves Nigel Burke. So we're going to go ahead and reload our alien patient. And this time we have to do a Pewdsball transplant. And that's easy enough. That's a pretty good one. I'll show you how to do that. That's actually a reference to PewDiePie. So there you go. Shout out to him. And if you haven't yet, subscribe to him and help him win the battle against T-Series. If you can call it a battle. Because he's winning. But anyways, that's pretty cool. There's also another transplant that's named after a YouTuber called Birgirspallex. I'm hoping I pronounced that correctly. But yeah, it's pretty cool that they're in the game. If Surgeon Simulator ever makes another game, hopefully I can be in it. Even if I'm just named after some alien organ, I would be fine with that. We're going to just try to cut this to get it out of the way. And now what we want to do is I'm also going to try to cut this. Just to get this, because this is actually the Pewdsball. This orange ball right here, this is the Pewdsball. And what you want to do is just kind of try to get all these bones out of the way. And you want to be careful when doing the alien surgery, because you don't have a syringe that, you know, slows blood loss. This little blue thing, you can actually just pull off. You just have to keep tugging at it. And that's exactly what I'm going to do, because it's in my way. I'm going to also move that away before it messes up Bob, even though I kind of slammed it into him. Alien Bob, sorry. And what we're going to do is just really try to pull this son of a bitch off, because it's not coming off. But I'm not lying to you, it does come off. It just doesn't want to this time for some reason. Oh my god, I might just leave it. I'm trying to figure out, is it even worth it? Is it worth it? Nah, it's not worth it or something. I don't really know what's going on. There we go. Get the hell out of my way. Jesus. So we're going to go ahead and grab the scalpel. And you're going to get the best one, which is that one. You better pick that one. And in order to cut the Pewdsball out, the actual incision is towards the top right here. Or, sorry, that's the bottom. But it's towards the top of the actual stem. So in order to get there, you want to kind of go at it at an angle. And you're just going to cut, you don't have to worry about getting A++. We're just going to cut the Pewdsball out by doing that. And as you can see, we cut that incision. But now we have this one in the top left. And we're just going to cut that out as well. And just dig around until the Pewdsball is loose. And as you can see, the Pewdsball is now loose. We can now transplant PewDiePie. Oh, if I can get it out. And we are going to open up the one that has the Pewdsball in it. If I can grab the damn hammer. That's not the one we need. So you want to be careful when opening these canisters. If you hit them too hard, the organ can go flying across the map and you won't be able to get it back. But that's it, guys. We will grab this Pewdsball that I just epically failed on grabbing, and we'll pop it into the spot that it needs to be. And there you go, guys. First success. That'll be for completing your first alien surgery. I'll have timestamps here for you in case you, for example, have the Gobbleshaft, the Robbaloraz, the Pewdsball, the Trangifier, the Cube Trangifier, if I'm not mistaken, the Gavichal. There's like 2 others. If you have any of those timestamps will be there, so that way you can click the one that you need. So without further explanation, we will continue with the alien transplant so I can show you guys how to do them efficiently. And then we can get our last 2 trophies and that much closer to our Surgeon Simulator Platinum. The Gavichal, that's a pretty easy one. We'll go ahead and knock that out for you guys then. So how you want to start getting the Gavichal is to grab the buzzsaw. And what you want to do is slowly just break away all of his bones right here. This is his alienistic ribs. And you want to try to just cut all of that, just to give yourself as much room as possible. You want to try to avoid cutting him like I am doing. I haven't cut him too much, so it's not a threat or a worry yet. But you just want to avoid even doing that in the first place. So don't follow my lead. Try to not do that to him. You can push that out of the way, much easier than trying to grab it. And now you want to grab a scalpel. And once you grab a scalpel, you are going to go ahead and start cutting out the Gobbleshaft so you can get to the Gavichal, because this Gobbleshaft is in the way. So these hitboxes are here on the right side, under the, like kind of towards the right of the blue actual tubes, whatever you want to call them, the Gobbleshaft tubes. And we'll go ahead and cut that right side, and now we got the left side to do. So we'll go ahead and go down and try to cut these hitboxes here. And we got that one. Now we need to come over here and get this one. Get this top one first, maybe. It might be easier. No, they're both kind of shit. So we'll keep trying to get these until the Gobbleshaft is loose. Still no good. I heard the buzzsaw going in his face, so that's not really good, but that's alright. I might cut it out. There we go. And now you'll see on the Gavichal, this is the Gavichal here, this orange thing with the little pricklies on it. And you want to cut right there. You see how that just cut? And then there's one in the top right as well. So you want to cut the top right one as well. So the Gavichal's pretty easy to get to now that we have the Gobbleshaft out of the way. You just need to cut that top right one, which I'm struggling with this scalpel. That's why I try to use the Master Race scalpel, which is this one. Just because, not that one. Get out of here. You're not no Master Race. This one here. And that way you guys can kind of, you just have much better reach with this one. It's absolutely amazing. It's the best scalpel in the game, hands down. Anyways, so we're just trying to cut that right one, which I think I may have actually gotten it just now. Yeah, it looks like it. And then there's one on this left side. So we'll try to cut this left side now before he bleeds out like crazy. Okay, we've just cut the left side, and now we just need to get this bottom part here. So we'll stab around here, and there we go. Just like that, the Gavichal's loosed. If it accidentally pricks you with those thorns, it will give you the drug effect like the syringe would. So just try to knock it away without it hitting you. And then what you want to do is actually get your replacement Gavichal, which we will need this for, which magically floated into my hands. And you just want to break this carefully without making your organ fly across the map. So we'll keep slamming it in there. And see what I mean? I almost launched it across. But we're going to go ahead and grab it, and we're going to pop it right into place. And just like that, guys, that's a Gavichal transplant. And we can go to our next alien surgery. Alright, guys, so next up we got the cubed Trangifier. And that's actually pretty easy to do. So you want to grab the buzzsaw and try to buzz away these ribs so you can get to everything much easier. Go ahead and buzz those. Buzz right there. Try not to hit Alien Bob if possible, because you don't have a syringe to slow down the bleeding, so you don't want him to be bleeding out. After that's done, you want to grab the really good syringe, which is, oh god, why'd I call it a syringe? I should be fired. You're going to grab the really good scalpel, and once you have that good scalpel, you're going to cut all the hitboxes to the Gobbleshaft. Now, we're going to just keep creeping along here, cutting the Gobbleshaft, and that should actually be fine. Once you have those removed, you can actually probably go in here and grab the cubed Trangifier, which is just this right here. We're going to go ahead and grab it. Or you might actually need to remove the Gobbleshaft, because I can't really seem to get a good grip on it. So we're not going to cut any corners. We're just going to cut out the full Gobbleshaft. Make it easier on us. And it doesn't take long to cut out anyways, because the hitbox on the things are pretty good, like you can see. And now we just need that one more, and there it goes. Once it wiggles or laughs, it's out. So we'll go ahead and smack this thing out of the way, just because it's kind of obstructing our view. We'll just knock that out of the way, or not, and we'll just try to grab it now. We just grabbed the Gavichal actually hit us just now. That's what's causing us to be drugged out. But now that we can finally move that blue thing, it's not a big deal. And we can pull on this, and that'll finally come out. You got to give it a good tug, otherwise it will not come out. So once you do that, you now have to get something to cut it with. So we'll try to get this scalpel and see if that'll go down there. It should. And sure enough, we cut it out. Hopefully. There we go. Cut it out, knock it out of the way. And now we're going to grab the... Sorry for me being drugged, because I know that's kind of a pain in the ass to see, but... Now we're going to actually go to the cube Trangifier canister, which is up in the top right. I'm going to bust it open. I'm going to grab the cube before it floats away. There we go. And once you grab it, all you guys have to do is place it where it would go. And it's that easy, guys. The cube Trangifier is now done. And we have more alien surgeries to cover. Alright guys, so as you can see here, we have a Gobbleshaft transplant to do. And that one's actually really easy to do. All you have to do is grab the buzzsaw and just start cutting out the rib bones. And that way you'll get access to the Gobbleshaft. And just try to kind of cut it as close as you can. Give yourself plenty of room to get in there. I keep hitting him because I'm apparently doing very bad right now. So we're going to go ahead. That one's still hanging on just a little bit. There we go. So now that all of that has been removed and is kind of out of the way for you guys, I want to just move the bones out of the way just so they're not really messing with your operation. There we go. I'm going to move that blue thing as well. All you have to do is just rub against it and it'll come off if you want to move it. So now we're going to grab a scalpel. And that's right. We're going to grab the good one. And all you have to do is there's these little hitboxes right here towards the actual center of the Gobbleshaft. You can see like a little line. And what you want to do is you just want to cut that line on every part, like each side. So there's 3 on each side. You don't want to accidentally cut the tubes off. So be careful where you're moving the scalpel. If you cut the tubes off, it won't recognize it and you won't be able to do it. So you'll have to restart. And once you actually get the last one, the Gobbleshaft will be removed. Now, what we're going to do is grab the replacement Gobbleshaft on the bottom left canister here. We're just going to bring that close enough to get it out. And we're going to grab the Gobbleshaft. And we're just going to drop it in, guys. That easy. And you will get a Gobbleshaft completion. So we have, I believe, 2 more to cover. And then you guys are done with the alien. Alright, guys. So we have a Robbaloraz transplant. And I believe this is a glitch. So I'm going to show you what the Robbaloraz is supposed to be and what it's actually thinking it is. And apparently this is a pretty common glitch on the alien transplants, which is a bit weird in my opinion that he'd even... I don't know how this even happens. I know that this was obviously developed by a small team and not, it's not AAA type title, exactly that. But basically what we're supposed to do is Robbaloraz is actually that purple organ down there with the green spots. But it's glitched for some reason. So instead of actually removing the Robbaloraz, what it's wanting us to do to complete this alien surgery is to get what's called the Birgirspallex, which is this down here, this kind of purple intestine looking thing. And I'm going to show you how to replace that. We're just going to remove the bone there. And we'll move that out of the way. And now we're going to get the long scalpel. If I can grab it without messing up, which I messed up. Horrible. Absolutely horrible. That's fine. We'll just grab the other one that I'm also messing up on grabbing. We ended up grabbing the long one anyways. Awesome. I meant to do that. So what we're going to do is actually cut out the Birgirspallex. And it says Robbaloraz, but for some reason, it's actually just bugged. And I'm not really sure why it does that, or if it's going to do that every time. Just know the difference of the organs, and if for some reason you're trying to put in what's supposed to be the Robbaloraz and it's not actually completing the surgery, then you know yours is glitched as well, and you have to actually do the opposite organ. So it seems like the Birgirspallex, which is that intestine I just pulled out, and the Robbaloraz are bugged in the sense that you have to basically just reverse order them, and you're actually doing the Birgirspallex when it says Robbaloraz, and you're doing the Robbaloraz when it says Birgirspallex. So we're just going to break that open, and as you can see, when I grab this, it should complete it now. So I'm just showing you this glitch so that way you guys know you're not doing anything wrong. It's just the game being dodgy. And this game does have a lot of dodgy moments. But see, as you guys can see, that was supposed to be a Robbaloraz surgery, and we just replaced the Birgirspallex, which is the intestine, and it completed. So now we should just have one surgery left, and I'll show you guys how to get that completed. Alright guys, so as you can see, now it's asking me to do the Birgirspallex, but we're going to actually do the Robbaloraz. And I don't know why it glitched. I have so many hours in Surgeon Simulator. Easily, I want to say over 300 hours, because when I first started playing it, it took a lot of practice to get to where I'm at now. Nigel Berg status. No, I'm just kidding. But it's taken a lot of work to get where I'm at. And I don't understand really this glitch. I've never come across it. But I figured I would tell you, because for the past, I want to say 3 hours, I've been recording trying to get a good video of that, and it just would not complete the surgery. So you don't waste your time like I did, just go ahead and do exactly what I said and just do it in reverse order. So if it says Robbaloraz, it's Birgirspallex. If it says Birgirspallex, it's Robbaloraz. And that's only if it's glitched, because like I said, this is my first time coming across that. I've never had an issue. But it could happen apparently. So just so you know, so you're not wasting your time, but I wanted to keep you guys informed. So that's why I did show the glitch, so that way you don't think you're doing something wrong and get discouraged and stop going for the platinum, especially being this close. So we're just going to cut out the Gobbleshaft to get to the Robbaloraz, even though the surgery is saying Birgirspallex. If you guys can, smash like if this has helped you at all. I'm trying to put as much effort as possible into this video because I know it's a fairly challenging game, but once you learn the mechanics, you guys will be masters at this game. It's mainly the dodginess and the mechanics that you just have to kind of get accustomed to. So we're going to cut out the Gobbleshaft. Now that that's out of the way, I would like to clear this bone out of the way a little bit. So what you want to do to replace the Robbaloraz is what it's actually called. You want to cut just this left incision point right there, and then this one on the top. You don't want to cut the one on the right. So just that one and the top. Okay, once that's actually removed, you can go ahead and smack it out of the way. And now we are going to open the canister that has the new Robbaloraz in it. So we're going to go ahead and take this, and we're just going to smash that nice and gently. That was a bit weird. And we're going to take the Robbaloraz, and we're going to go ahead and just drop it on it. And that easy, guys. You will get the trophy, Best Surgeon in the Universe. That should have been your last surgery. You will have them in a random order. So hopefully it helped you guys. I'll have timestamps so that way you can find the correct alien surgery you need. And you guys only need one trophy left for the platinum, which is arguably the hardest. But now with all this experience, you guys will get it, and I'll show you step by step how to A++ every single surgery. Alright guys, so the final stretch is a fairly long one, and basically you have to go back through and A++ anything you haven't. So I'm going to show you how to A++, and you can just watch them and then try them yourself. These will be a little bit quicker now that you have kind of, you know, the hang of everything. So if you need to slow down the video or anything like that, or like I said, watch it beforehand. Okay, it would have been quicker if I get that off. Just go ahead and do whatever you need to do to actually go at the pace that you are comfortable with. Basically, this will just be a guideline to help you guys get A++. Now, your A++ ratings are actually just based off of how well you do the surgery, in the sense that you don't lose a lot of blood. That's the only thing that actually factors into it. Time does not matter. You could sit here for 20 minutes and then finally do the heart surgery, and it will not affect your rating. The rating is solely off of the blood loss, which is really easy to avoid, except for the ambulance ones, which are obvious because the drunk driver. So we're going to go ahead and grab the long needle just to get a good kind of stab in here, because you don't want to stab around as much when you're doing the A++ runs. You kind of want to just stab where you need to stab and be done with it. So as you guys can see, about a minute for this one, and you get the A++ rating. So we'll go on to the next one. Alright guys, our goal here is to do a double kidney transplant and get the A++. So what you want to do is remove the cover and grab the long needle to get yourself enough reach on this one. And what you want to do is hit the hitbox on the right side, bottom right, and then towards the bottom left, then middle left, and then top left, and that'll fully cut out the intestines. I still like to remove the stomach. You can do so if you feel comfortable, if you feel like you won't lose too much blood. And then do the kidney, which is out, and then just go ahead and go for the left kidney as well before clearing out everything, which I just did. So now that he's losing blood, to secure your A++, now that you've done all the cutting, all you need to do is grab your green syringe, give him a stab, and you will get A++ now. There is no way you won't get it unless you were missing the hitboxes and you were cutting him up a lot. You just want to avoid losing as much blood as possible to avoid not getting your A++ rating. So we're going to keep squeezing to try to get that out. There we go. And we'll go in and kind of clench just by doing R1 and R2, and then you just pop it right in there. Just go ahead and let it fly down, and it should register, and you guys will have the kidney done. There you go, guys. Double A+ or A++ on that, minute 26 seconds. You guys can do it. Alright guys, so next we have the brain surgery, and there's no rush when getting these A++ ones, because that's the whole point of them, is just blood loss. So you're in no hurry whatsoever. If you have to take your time, just do that. There's no rush. These are really only hard if you want them to be. Except again, maybe the ambulance, because you can be doing just fine and something fly by and hit Bob, and you know it'll do a lot of damage. But you have no control over that. It's just a little RNG. If you keep at it, you'll get it. But right now, let's just focus on the brain one for the standard operating room. And you just kind of, like I said before, just use the back of the hammer and gently rub it against, because as you can see, we've only lost about 30 mils of blood, which is already really good considering his whole skull has almost been removed. We'll just go ahead and inch around, just slowly, gently rub on the left analog, and that'll cause you to smash against the skull. And again, smash against his skull. We'll go all the way around, and as you can see, we've cleared it. I'm just going to actually trim off the excess bone that would probably get in the way, just to be safe. And that should actually suffice. You could stab him with the green syringe if you feel like you're losing blood really quick, just to be safe. But if you're fast, you really won't need to for these first couple surgeries, just because they're fairly simple. If the stem's not showing, you want to kind of try to get it to show to where you can get your syringe in there without really messing him up. But I'll probably have to stab him a little bit, which is okay, because he can still take a beating. I've only lost 200 mils of blood. And we'll go ahead and grab the brain, and that easy, guys. You have A++ on the brain surgery. Alright guys, we're here with the eye transplant in the normal surgery, and we're going for A++. Another really easy one. All you have to do, grab the scissors out of the box, or whatever one you can grab. I still recommend the scissors due to the hitbox they have. I'm kind of going to have to jab it in him a little bit because I had it at an awkward angle. That's alright. Now we're going to go ahead and stab it into his eye. Pull it out. And as you can see, that'll cause him to bleed the most usually. Just for the sheer fact of sometimes it resists you. And it just messes his eyes up even more. And you lose a fair bit of blood. So once I actually get the eyes stabbed and pulled out, we're going to grab the syringe. Now if it's hard for you to grab it out of this container, because it is a bit skill I guess in that sense, you can, before you even start, you can get the green needle set out how you would prefer. That way you're not struggling to get it, because like I said, you can take your time for these runs. So if you need to remove that green syringe beforehand, that way you don't have to try to awkwardly grab it, do it. Make the platinum that much easier for you guys. Okay, once we remove the eyes using the black box, we're going to actually get another pair of scissors. I'm just going to go ahead and empty the eyes out since I will obviously need those at some point, which I am throwing them all on the floor. There we go, we got a couple on there, that's fine. And I'm going to get another pair of scissors to try to cut the, that's a pair of tweezers, that's not what I wanted. So what we're going to do now, since I just dropped those, we'll grab these ones here because they had a pretty decent angle. And we're going to use these to cut the retina. You want to mainly try to hit the retina just so you're not losing, you know, blood. You want to try to avoid losing as much blood as possible. So we'll go ahead and turn it this way and we'll try to cut some of these retinas. And for the retinas that are kind of in an awkward spot that I can't really hit with how I'm holding this, I'm actually going to grab the scalpel that I like. And we're going to just reach on in there and hit the other retina hitboxes. This will be much easier for you if you need to grab a new tool to hit a certain spot without really damaging him. Go for it, because as you can see, that just saved me quite a bit. So now what we'll do is we'll grab the green syringe again just to give him a stab in case we're taking too long to put in his actual eyes. And then we'll go ahead and go for the eyes itself, which I'm not sure how they actually fell out of there. I had a couple in there. I had like 4. So once it's magnetized to his face, you can let go, and that'll pop right in. We'll go ahead and give him this black one here. And there you go, guys. A++ on the eye surgery. Alright, guys. Next we have the tooth transplant. And all you have to do is grab a pair of scissors to remove this surgical mask. There we go. And now you want to remove the teeth. So I'm going to go ahead and grab the dental hammer. You want to be gentle, otherwise you will lose a fair bit of blood using the hammer. Especially if you're not hitting his actual tooth and you're hitting his lip, for example, like that. But that's okay. We'll go ahead and just smash out that tooth. We'll go for the next decayed tooth on the bottom. Just give it some nice good taps to hopefully knock it out as quick as possible. The good thing about the tooth one is once you have the actual teeth knocked out, the decayed ones, you can literally just hit the green syringe in him and you will easily secure your A++. So now that we've done that, he's not even bleeding out a lot, but just to actually secure it, like I said, we'll give him a little jab with this in the neck and he will no longer lose blood. We'll go ahead and grab the tweezers and we'll go ahead and lift the actual tooth things up. And that's a little awkward to do, but you'll get it. Just keep pushing it up. And now what we're going to do is replace those teeth that we pulled out. And we know the decayed tooth was on the top there, which again, this will all be randomly generated for you. So just try to remember where the decayed teeth are in case you knock out any healthy teeth. Like for example there, I put a tooth back in a healthy spot. So we'll go ahead and finish this up with one last tooth. And that easy for the tooth surgery, guys. You will have your A++. Now we're going on to the corridor. Alright guys, next we have the corridor transplants, and they're very, very easy. You just have to know kind of what the best approach is. And the first one we got is the heart transplant. So the first thing you want to do with any corridor transplant is secure yourself a green syringe. And try to not hit Bob in the face with a box of scalpels, preferably. So now that we've secured our green syringe, in case we need to stop him from losing blood, I'm just going to get rid of those. We want to look for a buzzsaw, a scalpel, and of course the heart itself, which will be the replacement heart. So right here will be the replacement heart, and we'll go ahead and just grab that, and you can set it near Bob's head. You don't have to do this. You can just wait for it to come by when you're actually ready to put it in. But if it comes by, I mean, you may as well. If it falls off the cart, it will respawn into the icebox, and you just have to wait for it again. So here we go. We've got the buzzsaw. That's the most important thing, because you'll always get scalpels and things like that. So the buzzsaw actually spawned. Now we're going to remove the same 4 to 3 ribs that we usually do. And there we go. So now I'm going to turn it this way, and I'm going to get these ones here. I'll probably actually just remove the first 3 just to save myself blood. If you can do that, go for it. If not, you can still do the 4th one. You should be just fine. Just be careful not to nick him with the buzzsaw. Okay, now we're going to go ahead and remove the lung. And now we need a scalpel. And these are kind of in an awkward spot. So like I said, there's no rush doing an A++, so just wait to get a better setup. Don't, put yourself at a disadvantage. So as you can see, this one's perfectly straight. So I'm going to move that out of the way, and I'm going to go for this one. Perfect reach. I should be able to hit those hitboxes on the heart easily, as you can see. And then there's one behind this bone. You just have to kind of know where you're aiming and move it out of the way, and too easy, guys. So then you can go ahead and remove the old heart. That's a bone. And just try to get in there and grab the heart. Sometimes that can be a pain because of the bones. If you clench your fist and then press downwards, you should be able to get in there and you'll grab another piece of bone. Now you should be able to just kind of reach in there further down and grab it by clenching and then letting go and then clenching again. So now we'll go ahead and grab the replacement heart and pop that right in, guys, and move on to the next surgery. Alright guys, next up we have the double kidney transplant on the corridor, and that one's another easy one. Again, just give yourself as much time as you need on these. I recommend just getting the kidneys last, otherwise they kind of dodge out. So first thing we want to try to secure for ourselves is a green syringe. So we'll just wait for the trolleys to come. You can kind of get a glance at where they're coming from, so you have a jump on what you're going to grab. There we go, from this right side. Again, there's no green syringe. That's kind of our main focus. That and a really good scalpel if you have the time to look for one. But here we go. We got a green syringe here. You can try to grab it. If you grab the container instead, that's fine. Just gently move it so you don't stab yourself. And try to dump it out. So we're going to tilt it kind of upwards so hopefully it doesn't stab us. And there we go. We've secured a green syringe. Now we need a scalpel. And this is actually a pretty good one with the length it has. And it's a pretty straight position. So we're going to go ahead and grab that as well. And now that we have everything to get started, which is just a scalpel and a syringe, we'll go ahead and start operating on Bob. Hit the bottom right hitbox, bottom left, middle left, top left, and you'll get them out easy like that, guys. Once you learn the hitboxes, you'll get them out easy. There we go. We're going to go ahead and go for the kidneys real quick as well. Kind of have an awkward position there, but I think I just moved it. You can kind of see them move. And we're going to stab this kidney out, which just happened. And then right after that, you want to go ahead and you can just chuck the scalpel and go ahead and give him a good stab with that green syringe that you secured. Next, you just kind of want to give yourself the opportunity to move all this crap out of him. And that way it just makes it easier on placing everything in. So now we'll go ahead and remove his old kidneys. We'll do this nice and easy. That one's kind of being a pain to grab. I definitely cut it though. There we go. I was going to say, I saw it move when I cut it. And perfect timing, the kidneys just dropped by. So we're just going to quickly chuck that in there. And then go back and grab this one before the trolley goes away. Which I don't know if I'll do now because I was kind of messing up. It's like it won't let me grab it, to be honest. Okay, so we'll go ahead and let the trolley come back with the other kidney. We can wait. Again, A++ runs, there's no rush. There's no kidney on that trolley. No kidney on that one, so we'll just try to put this one back in place with our spare time. There we go, perfect. Looks brand new, Bob. We're just waiting on the left one to come back, which again, still no kidney, and there it is. So we're gonna try to grab that. It's being dodgy again. The kidneys dodge out a lot on this surgery for some weird reason, and it is a bit frustrating, I'll be honest with you, but if you knock it off the edge there, it's going to cause it to respawn. And as you can see, it respawned 2 brand new ones, and then for some reason you're able to actually grab them again. So if that glitch happens to you, that's how you solve it. And there you go, guys. A++ on the double kidney transplant in the corridor. Alright guys, so the first thing you can do is try to secure yourself a green needle and just dump it out on the table here with Bob. Next we're going to need a hammer. You could use the dentist hammer, but the other hammer is better due to the hitbox and the kind of reach it has. And then you also want to grab the brain whenever that comes by, and that'll be easy because you can just kind of set it on the cart in front of Bob. And you, like I said, you could use the dentist hammer. There's nothing wrong with that, but you would want to try to straighten it out if anything. Kind of like that. Unless you can get the actual hammer, which we'll see if that comes by. No, so we'll just go ahead and use the dentist hammer on this one, and I'll show you what you can do with it. You can still use the back like the regular hammer, and that might even work better for you, honestly. It just kind of depends, because it doesn't have as long of reach, so you can slowly, gently rub the skull like you would with the big hammer, but you don't have to worry really as much about hitting him. So the dentist hammer works the same. It doesn't do more damage or anything like that either, so it's basically like using the regular hammer. Just try to get a good grip on it. If it's not in a good place, you can do what I did and flip it and then pick it up. Next we're going to kind of tilt it, and I'm going to go down with L2. And just, that's what I mean. You don't really have to L2 at all with the regular hammer because there's so much range or length on it. But that's not a big deal. We'll just slowly rub the skull and kind of break away all this. And we'll go ahead and lift up on the right analog a little bit to try to get these pieces. There we go, guys. Rub that against his skull. Now we just need the front part, which you can use the front of the hammer if you need to. Just don't ram it into him like I just did right there. I pressed my analog a bit too hard on that one. But that's fine. He has plenty of blood, and we're basically done here. Once you remove the top, you are free to kind of smack that out of the way and just go ahead and give him a stab. Unless you're not, like, for some reason you did that and he's not bleeding out at all. That's amazing. And then go ahead and try to find, you want a scalpel that has a good amount of range. I mean, this one's perfectly straight, so this probably would be a good one to go for. So since I found that one, just find yourself something straight that you can use. And we'll try to readjust his brain a little bit, but it seems pretty fixed in that position. You just want to try to avoid cutting him as much as possible. But that was pretty easy, and you can easily just grab the brain right after, which I dropped. Awesome. And now we just want to wait for another brain. But essentially, you would have been finished there. You would just grab the brain off the trolley and pop it right in and get your A++. So we're really just waiting on another brain. I'll speed this part up for you guys. As I said that, never mind. We got the brain. And we're just going to go down and grab that and pop it into his head. And that's it, guys. Once I can do it. There we go, guys. A++ on the brain surgery in the corridor. Alright, guys. Another easy one here is the eye transplant in the corridor. And what you want to try to secure, right off the bat, we got lucky, is the green needle. So just try to get that onto here. And we'll just dump it out of the box without pricking ourselves. And I'm also going to save the black box. It's not really needed because you can always just grab one as it goes by. But we'll use that to pop his eyes out of the sockets. Now we want to try to get a pair of scissors preferably. Which would be right here actually is what it looks like. If I can move the buzzsaw out of the way in time and grab it before this trolley moves, then we'll be in business. I got it just as it left. So now we can go ahead and start the surgery. You can start the surgery for any of these as soon as you have that green syringe. I do not recommend starting it until you do, just because you can cause him to bleed out and you have nothing to fall back on. So remove the goggles now that we have everything we need. And we're going to use the scissors to stab his eyes out. You can lose a fair bit of blood when you do that, and that's fine. Because you have the green syringe, like I said. As long as you grab that first, you'll be alright. You'll get this easy. So once we pull this out, more than likely, no matter how good you did that, you're going to need to stab him with the green syringe. So once you pull those scissors out, go ahead and set them to the side. Try to keep them at a good angle in case you need to use them. And we have the green syringe. We used it on him. So we're going to go ahead and pop his eyes out next by using the black box we put on the side. That, or if you need to grab a black box or a cup or anything like that, you can do that. That just helps get the eyes out fairly quick. And now we want to start cutting these retinas. You just want to be very careful with it, or you can cause them to lose a lot of blood, which will ruin your A++ rank. There we go. We cut his left eye out fairly easy. We're going to go for his right eye now, which doing pretty good on as well. And we're going to try to get this last one, but don't slam the scissors into his head like I just did. Take your time, really. And there we go, guys. We'll drop the scissors. We'll give him another stab. And now we're honestly just waiting on the eyeballs to come back through. If you see the eyeballs beforehand, by all means you can grab them and dump them out on the tray because they'll stay there. You just have to be careful how many you drop because the eyeballs will get stuck on scalpels or scissors. And if you have those on there from the surgery, you can't use them once they stick onto a scalpel or you know, scissors. So now we have some eyeballs. I'm just going to set that down to get kind of a better grip on it and just start dumping these out. That was weird. They all kind of just flung everywhere, but thankfully I do have two, so as long as I don't mess this up, I can just finish it with these two. And as you can see, it magnetized to his face. We have the last eye we need to grab. We got a really good grip on it. This should be no problem. And there you go, guys. If I can just get that little son of a bitch in there. A++ on the eye. So check you guys out. You're already almost halfway through these A++ runs. The ambulance ones get a little harder. But anyways, we'll go ahead and start. This one is the teeth surgery. So you want to get scissors for the face mask. We'll just go ahead and set that on him. And we want to secure a green needle, which we thankfully got in a black box, which also had a pair of tweezers, which you'll need the tweezers to put the teeth in. So we'll go ahead and drop the tweezers out as well, which I think are kind of stuck on me. There we go. So now we can go ahead and actually just start. We have every tool we need for the teeth transplant. The good thing is you don't need much for a tooth transplant. And we'll try to move that without dropping the needle off. So what you want to do is remove the facial mask here. Preferably with the scissors. And we'll also need to get a dentist hammer. Or you could use a regular hammer. Don't really recommend it, but you can. We'll just inch up on him. I really recommend waiting for the dentist hammer, to be completely honest. But we'll try it with the regular hammer. We'll see how we go. If you're experienced, you'll get it with the regular hammer, no problem. So we'll just slowly grind that against his face. And there we go. Got two decayed teeth out. Now we just need this bottom one here. So I'm going to gently rub this hammer against it. I bet that feels pleasant. There we go. And once you guys have done that, if you use the dentist hammer, good on you. I don't recommend using the big hammer. But as you can see, it worked just as well. And we'll go ahead and try to pick up these tweezers here that I've set down beforehand. And for some reason they're at like an awkward angle, so it's not letting me grab it. I'll try to press them downwards on his chest. And then that way, hopefully I can grab them. It's odd. It's like there's no hitbox. There we go. Okay, so we'll go ahead and drop those again and get a better grip. It's a lot of just trying to pick shit up in this game. Alright, now that you finally picked up the tweezers, you can go ahead and, if you haven't lifted up one of the new teeth openings up here, just go ahead and open those up to get access to the fresh teeth. And these always have problems with connecting with the tweezers, but just keep trying and they will eventually stick. And as you guys can see, We have one left. This would have even popped another trophy for us if we already didn't have it, which was you can't handle the tooth if you've been following the guide. And there we go, guys, just upwards, and you get A++ on your last corridor surgery, and now we can go to hell. I mean, the ambulance ones, which are fucking hell. Alright, guys, so our first one with the ambulance is the heart transplant. So you want to move that cover out of the way, and on the right side you have the heart, the green syringe, and on the left side you have the buzzsaw as well as the scalpel. So before the ambulance starts driving like crazy, you want to try to cut as many ribs as you can, but you want to be careful as well because he can suddenly hit the brakes or slide left and you can slam your buzzsaw into Bob, causing him to lose a lot of blood. So do this quickly but also carefully. And as soon as you get that, you can go ahead and throw that over there. I recommend actually throwing the buzzsaw out the back door just so it doesn't come back and hit him in the face. Because really a lot of this is just when he's driving, it'll hit him in the face and things like that. Same for like this hammer. If I can get a good grip on it. You don't have to throw everything off because that'll just waste time as well, which you're in no rush, but you just want to get rid of things that can actually harm him a fair bit. Like the fire extinguisher will make him bleed out really fast. Once you've removed any hazards, if you need to, because you might not even need to, you may be really quick and can just knock it out. When the ambulance isn't moving is when you want to go for these heart hit points, and then you want to hurry up and get your scalpel out of the way so he doesn't slam left and then, you know, cause Bob some serious damage. You can try to get the old heart out, or you can just leave it in there because when he slides, it'll fly out, and you can just try to put the new heart in. And if it works, which it's not going to now, but now that the heart's moved, we can go ahead and slam that in there. And now it just needs to be adjusted and it should trigger. There you go, guys. A++ on the ambulance, and it's that easy. Alright, guys, this might be one of the harder ones, but you can easily get it done. I know you guys can. The scalpel and the green syringe are on the right side. So you want to try to get the long scalpel if possible. Give yourself as much length as possible. And you want to start cutting before the ambulance starts sliding around. Now it's random when the ambulance slides and everything, so you can't really time this. You just have to pay attention that when he's sliding, you want to try to move your scalpel away from Bob so he's not getting grinded up by it. We're trying to just get this hitbox done now. There we go. And we'll get the top left. And he'll hopefully hit the brakes soon and he can clear out the kind of like loose organs that are just chilling in Bob right now. We'll cut the stomach as well. And we will go for the kidneys really quick as well so we don't have to drop the scalpel, just like I've shown you in other videos. Once it stops throwing me around, I'm going to go ahead and go for the kidneys. We've only lost 200 mils of blood so far, which is really good. And we'll go for the last kidney over here. And hopefully he'll slam on the brakes again and move everything. And we'll go ahead and throw the fire extinguisher out of the way. And we'll go ahead and grab the green syringe. Try to grab it before he goes flying around again. And we'll go ahead and just set that up there. Now you want to just try to clear everything out really so you can put the new ones in. The thing that can be annoying is your new organs can fly out of the ambulance, so you got to be careful and make sure they don't fall out. And as you're putting them in that correct spot, he can also slam on the brakes and move them out of the correct spot. And then you have to constantly readjust them. So we're going to go ahead and grab them now. We'll move stuff out of the way in order to get to them. And we'll go ahead and drop it in. If you're quick, you can do it before he starts moving again. And there you go. No, see, as you can see, there we go. He actually hit the slide brake and it actually pushed it into where it needed to be, getting the A++ on the ambulance surgery. Alright guys, so this one's not exactly too bad. It might take you a couple tries. All you have to really do is get the hammer and use the back like I've shown you before and try to get his skull off so you can replace the brain. Now if you ever feel the ambulance being jerked around, you want to step far back from Bob as much as you can so you're not jabbing the hammer into his head. Otherwise he will lose a lot of blood. So we're going to go ahead and just inch around the actual skull and see how I'm getting jerked around. I'm going to back up away from him just so I don't swing into him because you lose a lot of control. Like right there when I went forward, I was actually lunged forward. And again, you don't want to lunge forward at him. So it helps to just stay back. You're not in a rush. Just stay back. Make sure you don't hit Bob. And just slowly inch away at his skull again. And the second you lose control again, just go ahead and back out. And you'll just keep rinse and repeat until you get the entire skull off. It'll be very, very easy. You guys will knock this one out. I'm hitting his face a little bit, but that's okay. He was fine. It's kind of wobbling. We're going to slowly inch away at that bit. There we go. Now we just need this a little bit up in the front. We'll try to get it before he slams the ambulance to a certain side. We'll try to get it right now. Hopefully we can get it before he moves. This bit is actually a bit too high, so I'm going to actually trim that off and then trim that one off. So now that you've actually removed his whole skull, what you want to do to ensure that you're not running out of too much blood is grab your green syringe. That's blue. You want to grab the green one, which is right there. Give him a quick little jab. And now we have to do what I guess could be considered the hardest part, and that's to cut the actual stem of the brain. So you want to grab a scalpel that's long enough to give you enough reach and at a good angle. That one should be perfect, actually. You want to avoid stabbing his brain, and you also don't want the ambulance to lose control and then you mess it up. So we're losing a fair bit of blood now. We should still get A++, so we'll hurry up and slam it in before it's too late. I'm losing control because of the ambulance, so once I get control back, I'll slam that in there. And as you guys can see, A++ on the brain surgery in the ambulance. Alright guys, next up is the eye transplant. This one's actually pretty easy too, since he's in an upright position. Nothing will really damage him by moving. The only thing that can damage him is you. So whenever the ambulance loses control, just make sure you back away from Bob so you're not smacking the crap out of him with whatever you're holding. Once you cut off the eye goggles with the scissors, go ahead and quickly use them to stab his eye. You want to be fairly quick about this just so you can go to the green syringe afterwards. So we'll go ahead and set the scissors down, and we'll try to grab the green syringe. If the green syringe is hard for you to grab out of the bottle, you can have it ready beforehand by just grabbing the bottle and throwing it around, and then setting it down on the table for you to grab easier. So we'll go ahead and give him a stab with that. And next we need to actually remove his eyes. So we'll just grab this black box and we'll just start slapping him around. The good thing is he won't lose blood from this. He is actually losing blood from this hitting his head. So if you see that or the fire extinguisher or anything like that go and hit him, just move that out of his way just so there's no hazards hitting him. So we'll get this last eye out of the socket, and now we need to actually cut these out. So we're going to try to find a tool that's got decent reach and is at a good angle. If you can get it at the side, that's pretty good, so you can hit the front retina and the back. Now what you want to do is carefully hit these, and if the ambulance starts moving, you want to back up because you don't want to hit him in the face with the scalpel. So we're going to slowly inch up at him, start cutting these. We need 2 more on that one. We need 1 more now. We'll try to rotate the analog to go upside down, and as you can see, we should cut that easy. Now we'll get the last one. I might actually even give him a stab again just to buy us some time, because like I said, there's no race. There's no real rush for this. So if you need to stab him again, by all means do it. Get the green syringe and do it. Find another good scalpel placement, like how this one's at an angle, and go ahead and go to town on his next eye. So we'll slowly inch up towards it, and we'll start cutting the eye. Well, the retina, you don't really want to actually cut the eye itself. So start cutting the retinas, and we'll get this other one there, and now we need to try to rotate it, and since it's at an angle, we should get that pretty good. There we go, guys, that easy. And again, now we just need to put in the eyes, but just to be safe, he's only losing 1 per second, but you don't want him ideally losing any per second, so we'll give him a stab. And now we just need to grab the eyeballs, which thankfully are right here. They got popped out. If they didn't on yours, they're just up on the shelf and you can knock them down and grab more. That's a really good eye grab because it's outwards. It's not really in my hand, so it's easier to place into his head. Same with that one. Really good grab. And we are done, guys. You get the A++ on the eye surgery. Okay, guys, if I had to say which ambulance one is the easiest to A++, it would probably be this one. Just grab the scissors on the bottom right there. Cut off his face mask as quick as you can. Be careful if the ambulance moves to step back so you don't jab him with your scissors. Next, we actually want to remove the teeth. So we're going to go ahead and grab the dental hammer. Go ahead and move all this crap out of the way. And I should be able to get it now. That's a terrible grip on it. So what I'm going to do is... Oh, okay. Well, I was going to drop it and reposition myself, so I might actually just use the regular hammer for this one. And what we want to do is just get rid of his decayed teeth. And as you can see, I already removed one, and it didn't lose much blood, so the regular hammer could be a good option as well for you, whatever you prefer over that or the dentist hammer. And just use the back of it. It has a pretty good hitbox. So if you use the back of it, you have a pretty good range, and it's also kind of skinny, so it'll aim better at the tooth. So you can kind of like precision hit it. So we're just going to hit these teeth here. And even if you knock out healthy teeth, that's not a problem. You still have more than enough blood to get out of the way. So we knocked out a fair bit of healthy teeth, but we got rid of all the decayed teeth, which is your main concern. So now he's losing blood. So to secure our A++, we just want to hit him with the green syringe, and then we have the A++ secured. What I do recommend doing, though, in case things are hitting him, I say just throw those off. You don't want to have a good run, and then it get ruined because, you know, they just hit him in the face, and you kind of lose too much blood and lose your A++. So we'll go ahead and grab some tweezers, and we'll start replacing his decayed teeth. And they're actually all on the bottom row, which will make this even easier. And you don't have to remember anything. Just start filling in the teeth. As soon as you do all the decayed ones, the actual surgery will complete. So we're going to go ahead and just keep grabbing these teeth as best as we can. Whenever you're using the tweezers, I always say hold R1 and R2 because I feel like it does help secure it to where it can magnetize these teeth into it a little easier. Otherwise, it's a bit dodgy. So I think we just need to put one more in and we're done, and that should be an A++ easy because we've only lost 100 and, what is that, 88 mils? So really, really good job. There we go, guys. A++. You are out of the ambulance surgeries. I'm proud of you. We got the space surgeries next, and then that's your platinum. Welcome back to space, guys. If you did the ambulance A++ runs, you will easily get your platinum now. I'm just going to let you know that now so you can start getting hyped. So go ahead and type hype in the chat. No, I'm just kidding. But all you do is grab that buzzsaw on the left and just start inching away at the bones here. And you want to just cut the first 3 to 4 like normal. Preferably 3 if you can. Unless you need more room, but you really shouldn't because you're a fucking expert now. So what you do is you go ahead and pull this out, and from here we're going to go ahead and grab this scalpel that we didn't touch because this is a good one to grab. You just line yourself up and you press R1 and you're Nigel Burke. That easy. Cut the hitbox. Make sure to not actually cut his heart and just cut the hitbox. It's those little lines right there on the purple and on the red. And as you can see, we got the heart out. It's going to float to the top, and I'm going to accidentally push it back in, but we'll just push it out of the way, and we will grab the healthy heart before it floats off. And we will chuck the healthy heart down in there, and make sure you just kind of slam it in because of the gravity. And you'll have to probably work around with it a little bit until it actually recognizes that you have put the new heart in. So just keep trying, and you'll get it in just like that, guys. A++ in the space operating room. What is going on, guys? We have the double kidney one in space, and this is an easy one. You just kind of inch up on the master race scalpel and press R1 to grab it, and then all you have to do is just start operating. It's that easy. This is probably one of the easier space ones. Once you kind of master the kidney one, it's, I don't know. I like that you can literally just cut all of it and then be done. You can do it all in like one fell swoop. So we'll cut all these hitboxes here. We'll cut this one in the top. If that intestine will move out of the way, we'll try to swipe it away without swiping Bob. Now we'll go ahead and go down and cut that one. Might take a couple tries. Unfortunately, it's just how it is. There it goes. It'll launch out. You can go ahead and cut the stomach as well to move that out of the way. You do want more room on these ones because of the gravity will make putting in the new kidneys kind of annoying. But you'll get it. You'll get it easy. You guys did the ambulance ones. You guys do the big dick damage now. So we're going to go ahead and cut that one out, which I think I did already. Now what you want to hurry up and do is actually find the green syringe. And try to grab it without the perception messing with you. And just go ahead and give him a stab. And then let go of it. Now we're going to go ahead and clear out his innards. And just try to pull this liver as hard as you can. And it'll come out. We'll go ahead and come in here and try and scoop out these kidneys so we can get the new ones in there. There we go. Just give it a good grip and it'll come out. Now we need to get the new kidneys. And we want to do this carefully because of the gravity. So go ahead and grab the right one and just slowly kind of inch it downwards and it'll float down. And while that one's still kind of floating down, we'll hurry up and grab this one before it comes up. And the rib cage should kind of catch them as well. Now you want to just kind of tap them into place. So we'll tap this right one to the right and then down a little bit. And there you go, guys. That easy. A++ on the double kidney transplant in space. Next up, we got the brain transplant. We'll do this easy. We're going to go for the hammer. And we'll go ahead and just start doing what we normally do with the hammer on the brain surgery. And that's just inch away at the skull around the actual head of Bob. We'll just inch around the back like that and just barely rub against it. You don't need to do much. The gravity in this will just slowly float away the skull chippings as well, which is nice. Get them out of your way. So we'll completely remove that. We'll go to this side and we'll start at a downward angle and just rub against there. And we'll rub towards the front a little bit. Should be able to remove all this fairly easy. I think this is one of the easier ones. You really just need to be careful when removing the actual brain stem, because you may damage Bob's brain, and for some reason it does do a lot of damage. I guess because it's a scalpel to the brain. I mean, I imagine that would be a lot of damage. So we'll go ahead and gently try to get this front part. He's bleeding out now, so we do want to just kind of get this done with. But you still want to be gentle so it doesn't slam into Bob's head. You'll notice that when you're playing too, that if you're slamming in a little too hard, it'll just kind of ram into him, and you don't want that. We need just that little piece, and then we can go get our green syringe. Oh, this one's still actually connected, so we're going to cut this one too. There we go. So now once you've done that, you want to hurry up and get the green syringe before he bleeds out. That was actually a pretty decent grab. We'll stab him in the ear hole. And now we will go ahead and grab the brain. And since it's anti-gravity, it's a little nice because you can see the stems kind of floating, and that gives you a better angle to cut it. Now you just really want to find something that you can use to cut it that's in a decent spot. That one's too hard to get, so I'm just going to take my time and look for a new one. That's a spoon over there, so that's not going to do anything. We're really just trying to find a decent scalpel, which would be right probably there if I can get it. Well, my frames I think just dropped there. That was weird. Anyways, we did actually manage to grab that one, which was really good. We'll just slowly inch forward to get down in there, and we'll aim for the stem. Go down a little bit so we're not actually cutting his brain, and it's that easy, guys. You have now done the brain surgery with A++. On to the next one. Now you might be asking, yo, why'd you jump to the teeth transplant? Well, the eye one is actually the last A++ I need to pop the platinum, and we will make that our last part of the video, and we will conclude this full breakdown guide of Surgeon Simulator. If you've made it this far, thank you guys. I'm really hoping this helped you, because I know there's no video guides out there. And sometimes it just helps to have a visual representation of what's actually going on or what you're required to do. So anyways, for this tooth surgery, once we can kind of figure out what the hell we're doing right now, we're going to try and get the dentist hammer after removing the surgery mask. And we'll just try to grab it, if I can just get a decent hold on it. There we go. And we're going to open Bob's mouth. It's a little hard on this level because of there's two dentist hammers. What the hell? Well, there you go. If you can't get one, there's another one. And there's a normal hammer. So we have a pretty good lineup of teeth, to be completely honest. And like I said, his mouth might shut sometimes because of the gravity. So just try to get it open with your hand, and then slowly start inching away at the teeth. You want to hit the decayed teeth like normal, like you would do in a tooth operation. As you can see, we only need one left. He's slowly closing his mouth, but it launched back open once I hit it with the hammer. And he's not even bleeding out, guys. We did all of that with only losing 100 mils. It was a pretty good setup in teeth. So hopefully you get lucky as well with that. But all we need to do is grab tweezers now, which just flew away from me, and that's fine because we have these ones here that we're going to not mess up on grabbing, aren't we? And we're going to go ahead and use that to put in the new teeth. Now I notice in space the teeth are a little harder to grab with the tweezers. They seem to fly away after you've grabbed them even sometimes. So just try to grab whatever one will actually magnetize to your tweezers. Like these ones seem like they're trying, as you can see right now, but then they get launched away as I'm going back up. So there we go. We got a pretty good hold on this one. You should be able to find enough teeth that will actually stay on in order to get them. So we need one more tooth. We really just need it to stay on the damn tweezers. That's our main concern right now. And I think that last one just did it. So we'll go ahead and put that in there, which is around this left side here. And there you go, guys. A++ on the tooth surgery. Now let's go get the platinum. Alright guys, immediately with the eye transplant, head over to the top right and smack this blue needle away from Bob. And then try to remove all these hazards. For some reason, when you start this one, everything just seems to kind of fly at Bob. So definitely get the blue needle first. That's priority, because he will lose a lot of blood if that stabs him. It just causes him to bleed out rapidly. Once you can, go ahead and grab scissors or a scalpel, whatever you can get your hands on. And we're going to go ahead and start cutting the actual face mask right now. Or the goggles, whatever you would like to call them. We're going to try and go at the side right here and get those off. Okay, that wasn't too bad. Now we need to actually stab his eyes with the scissors. And then go ahead and grab him from the end and try to pull him out. You want to pull him out as quick as you can. As quick as it'll let you anyways. And now we're going to try to stab his other eye. So whatever eye you didn't stab, go ahead and stab that one. And once you get it in there, go ahead and pull it back out. He might be a stubborn bastard about it, but just maybe let go and re-grab it and try pulling again. And hopefully, if everything goes smoothly, he'll let it out. Now you want to grab the green syringe, which I just accidentally knocked with the scissors, but that's fine. I grabbed them. And you want to set it aside as gentle as you can so it's around, because you're going to need it maybe. In case you mess up on the retinas or anything like that, you might need it. So you want to just set it to the side over there, just so you kind of have it there in case you need it. So then we'll grab the black box. Don't worry guys, we're almost done. All the blood, sweat, and tears is about to pay off. This is the last one. And then you get your Surgeon Simulator Platinum. So we'll get A++ on this. We knock the eyes out, and now you want to grab something that you can cut the eyes out with fairly good ease. So maybe kind of just evaluate where you're at and see what might be good for you. I might go for this scalpel because I can kind of hold it at an angle with how it is. But I kind of messed up on it, and that's fine because it flipped around and I was able to actually grab it. So now we're just going to be really, really gentle when cutting out these eyes in space. Since there's gravity, you kind of have that working on your side, so you can kind of just barely tap it, and then he'll move his head a little bit, and you can just keep tapping around the retinas. And you should be able to get these out no problem. You want to avoid hitting his eyes though, so don't really rush because you don't really need to. We've got 3 cut on that one. We'll go ahead and jump to this eye and get a little bit of work done on this. Because then you can let that one float around, and then when an opening happens, you can just go for it, just like that, guys. So sometimes it might help to switch eyes and wait for a good opening on it. Just don't wait too long in case he's bleeding out. Like right now, I'm bleeding out by 2 mils, but that's fine. We'll get this eye out, and then we'll go ahead and give him a stab. We need one more, and I accidentally hit his eye a lot there. That's okay. We're still doing fine. We'll hit that last hitbox. Come on. I missed it, just barely. There we go. We got it. We're going to go ahead and go for the green syringe as soon as possible. Try to move that out of the way so I can get a good grip on it. We'll go down, pick it up just like that. Give him a nice little stab, and we'll gently drop it. And we'll go ahead and go for the eyes. And we'll go ahead and pop this eye in once it starts magnetizing to his face. And we only need one more eye, guys, and that's the platinum. That's that shiny platinum. That's what we were working for. Oh, that would have been awesome if I grabbed it, but fail. So we'll go ahead and keep trying to grab these. You can kind of move your hand around in there to get them moving around. And try to get it in a position to where you can grab it. Just like that. Just like that. Beautiful. Absolutely beautiful. Let's get that platinum, guys. A++. Best surgeon in the world trophy. And there is nothing more to teach. You guys have the platinum. You're done with Surgeon Simulator. I'm proud of you guys. If you made it to the end, I want to personally thank you and say you're awesome. If you found this helpful, smash that like button for me, please. I really appreciate it. This is my first guide since revamping my channel to Bushido Cypher. My next goal is 500 subscribers, and I know we can make it happen. So subscribe if you haven't, and become a member of the clan. I do also have a collectibles guide for The Last of Us, and you bet your sweet ass I'll be doing a new guide for The Last of Us Part 2 when that is finally released. I also take video suggestions, so leave any you may have in the comments below. As always, thank you guys for watching, and remember, you have only to believe if you wish to achieve.